थर्ड, है ना?
Hello, hello, Professor Adarsh Kumar.
Hello, Dr. Bilayat. How are
Yes,
you?
I
Good.
am fine. You also fine.
Yes, yes. Good to see you
Yes,
here.
yes, seeing you.
So
And
how is situation in Bangladesh?
Bangladesh situation is like India, more or less like India. That is
Okay.
very, very pandemic situation.
Yes. So yeah, this pandemic, this has created, you can say, so many changes in our lifestyle and
Yes,
all
yes,
these things.
yes,
And as a forensic expert, I can say what we are witnessing, so many number of suicides due to
yes,
depression and
yes,
all. Most of the times, even today, we conducted one autopsy where the history was same. The person was suffering from suicide, and he jumped from the building, committed
yes,
suicide. He was suffering from depression.
yes,
So I think that was the whole idea that in current scenario, so we planned this Webiloque on this particular topic where the persons from these
yes.
speakers from India and Malaysia will be sharing their views. So it's good to see you. Good to see you after a long time when we last met at Dhaka, December.
ಇದ್ರಪ್ಪ ಹೌದು ಎಲ್ಲ
Nilosha, can we start now?
Yes, sir. Yes, sir. We'll start it. It'll be
Yeah.
Somnita, Samil being
Okay.
the host this time. So, yes.
Okay.
I'll
Okay.
bring it
Okay.
over
Yeah.
to her.
Yeah. Because I think so people have joined, and so now it's 2:08.
Will go
Sure.
ahead, sir.
Yeah.
Very good afternoon to one and all present here. I, Soumita Samal, speaking on behalf of Alpha Forensic Group, welcomes you to yet another international webinar entitled Depression and Loneliness, the Dark Corridors of Life. Many a times, people do not wish to talk about depression and loneliness with the fear of being labeled uncool. I'm sure we all have come across people who seem to be very positive and strong individuals. Some of them try to entertain and keep others happy. Later, we realize that they are the ones who are the victims of depression and loneliness. Some of them overcome it, and very few of them are not able to. What might be the reason? Most of us probably feel the sudden pang of depression and anxiety, struggling with our day to day life. And with COVID 19 in our world, this is expected to get worse. Hence, I feel it is time for us to break the silence and speak to our friends and people who care for us about what we feel and how we feel. This might help us ease out our problems. I would like to take the opportunity to introduce our organizer for today, Alpha Forensic Group. Alpha has emerged as a great reckoning force and a dynamic forensic organization. Alpha is established by highly qualified and experienced forensic professionals to provide best forensic investigation and education services and proper advice and guidance for its clients for a better balance of forensic science expertise at various places. Alpha is a government registered organization that is highly respected independent forensic science expertise or service provider in India. I would also like to introduce our organizing partners, Indian Association of Medical Legal Experts, Asian Institute of Human Science and Development, Malaysian Criminological Correctional Association, Effort Forensic Society. I would now hand this over to Professor Dr. Adarsh Kumar, who shall lead us into the introduction of our panelists for today. Thank you.
Thank you, Somnita, for setting the tone for this very important, first of its kind of international Webiloque, where the faculty from two countries, India and Malaysia, have come together to discuss upon this very pertinent topic in current scenario. Because as we are witnessing this during this COVID-19 pandemic, you can say as a forensic expert, I have seen this so many number of deaths, suicidal deaths, due to depression. The ultimate, you can say, underlying cause is depression because of so many factors. The COVID-19, of course, has immensely contributed or aggravated to those kind of, you can say, depression and loneliness feelings. So I think this is the this current talk that it needs to be discussed so that it will be useful for our society, especially the youth who, what I am finding, the if I can share my experience, what we are seeing, the type of deaths what we are seeing, it is usually it is the youth. If people from India would correlate that only yesterday we have got a very we have lost a very bright student of the AIMS student, our student itself, and incidentally he was doing his post graduation in psychiatry. So now you can understand how much complicated this is. He was a bright student, MBBS from AIMS New Delhi itself, just selected few months ago for doing the MD psychiatry, and he underwent depression, and ultimately during this phase he committed suicide by jumping from the hostel itself day before yesterday, and it was the headlines all over India. I think people from every people can relate with that. So I think this is the high time that we should discuss this current problem scenario with the all galaxy of speakers, and that too from the different backgrounds. I am seeing the psychologists, the psychiatrists, the legal persons, and all the stakeholders involved in that. So it will be a great learning experience for all of us, I anticipate. With this, I will take this opportunity to welcome all the speakers. And to start the proceedings, I will introduce our two moderators. Professor Uday Pratap Singh is a very good friend of mine. He is a former head of Department of Anthropology, Lucknow University, Lucknow, and also the president or the chairperson of Asian Institute of Human Science and Development, one of the organizing partner, and of course Dr. Navpreet Kaur, uh, who is the project coordinator from the State Legal Services Authorities, State of Punjab. And her background, he's also done the psychology, and of course she did her PhD in law, currently doing that. In addition to that, she's also a very, you can say, very renowned human rights activist. I should say social activist, because she is involved in this acid attack problem in India. She has done immense work. She is also the vice president of the Lakshmi Foundation. As we know that even the movie was made, Chapak, on the life of Mrs. Lakshmi, who was subjected to acid attack. So she is associated with that. So she will be representing the Indian Association of Medico Legal Experts. These two will be the moderators of this today's proceedings. And with this, I welcome all these international delegates from so many parts. I saw Dr. Bilayat Khan from Bangladesh. Welcome, sir. My good friend Yudi from Indonesia, and so many which have joined afterwards from India and abroad. So welcome you all. And I hope this will be a great learning experience for all of us. With this, I'll request Professor Uday Pratap to start the proceedings.
Thank you so much. Thank you so much, Professor Adarsh Kumar ji, who is one of my great friend, and is associated with AIMS New Delhi, and also with Asian Institute of Human Science and Development and Department of Anthropology. And he has already introduced all the panelists, international as well as national. But I also would like to name them first, who is of Malaysia, Dr. Suzali Wahab, Dr. Adarsh Kohli, who belong to India, Dr. Helwa Abdullah of Malaysia, Dr. Hema Priya Jaipal of India, Dr. Zuriyati of Malaysia, Dr. Asha Srivastav, India, and Dr. Soumya Kumar of India, and Dr. very young and very energetic, our chap, very dear chap, Mr. Aksari Hussain Shakti, and Miss Tia. So these are our panelists. So first of all, we would like to share our feelings, particularly on the loneliness and depression. Friends, as you know, that loneliness is a horrible emotional response to perceived mental and physical isolation. It's often associated with an unwanted lack of connection and intimacy. It's overlap and yet is distinct from solitude. Solitude is simply the state of being apart from others. And not everyone who experiences solitude feels lonely. Very important. As a subjective emotion, loneliness can be felt even when surrounded by other people. One who feels lonely is lonely. One who feels lonely is lonely. The cause of loneliness are varied. So they include several kind of factors like social, mental, emotional, environmental, anthropological, and several kind of factors. Friends, research has shown that loneliness is found throughout cultures, including among people in marriages, along with other strong relationships. People in marriages, along with other strong relationship, and those with successful careers also. Most people experience loneliness at some points in their lives, and some feels is very often as short-term emotions. Loneliness can be beneficial also. It encourages the strengthening of relationships. Chronic loneliness, on the other side, is widely considered harmful. Friends, this is related with the numerous and reviews and meta studies conclude that it is a significant risk factor for poor mental and physical health outcomes. So, media seems to have agreed that rich countries are experiencing a loneliness epidemic. There are literally thousands of newspaper articles that use this exact expression. What is the evidence for this? The word epidemic suggests that are getting much worse and loneliness is increasing rapidly. But does the data in fact show that societies are becoming lonelier? No. Despite the popularity of this claim, there is surprisingly no empirical support for the fact that loneliness is increasing, let alone spreading at epidemic rates. It's true that more people are living alone around the world, but loneliness and aloneness play, take it quote unquote. Loneliness and aloneness are not the same. As a study explains that spending time alone is not a good predictor of whether people feel lonely or have weaker social support. So if we see on other side of the coin, that is depression. Depression is a common mental disorder, a state of feeling alone, hopelessness, sad, as well as many other emotions to that degree that normal life becomes nearly impossible to enjoy, or even just go through. Globally, more than 264 million people of all ages suffer from depression. So, dear friends, depression is a leading cause of disability worldwide and is a major contributor to the overall global burden of disease. More women, very important, very significant, dear friends, more women are affected by depression than men. Depression can lead to suicide. It's a common illness worldwide, with more than 264 million people affected. Depression is a different from usual mood fluctuations and short-lived emotions responses to challenges in everyday life, especially when long-lasting And with moderate or severe intensity, depression may become a serious health condition. It can cause the affected persons to suffer greatly and function poorly at work, as related with our students and workers, at schools and in the family also. At its worst, depression can lead to suicide. Close to close to 8 lakhs people die due to suicide every year. Suicide is the second leading cause of death in 15 to 29-year olds, my dear friends. So, although there are known effective treatments for mental disorders between 76% and 85% of people in low and middle income countries receive no treatment for their disorders. Barriers to effective care include a lack of resources, lack of trained health care providers, and social stigma associated with mental disorders. Another barriers to effective care is incurative assessment. In countries of all income levels, people who are depressed are often not correctly diagnosed, and others who do not have the disorders are too often misdiagnosed and prescribed antidepressants. So there are few kinds of uh, and symptoms of depressions. And if we go, I'm not going in detail because there are several panelists who are waiting also. So, dear friends, recurrent depressive disorders and bipolar affective disorders. These two kind of disorders who are very big category, big types of depression. So thus, friends, loneliness and depression is likely the most common psychosomatic disease in the world. A serious debate regarding how and indeed whether it is manifested in the countries of various descriptions like Western, non-Western, underdeveloped, developed, developing, industrialized, primitive, civilized, and these words can be cited also. Its diagnosis presents Western, but its diagnosis presents Western trained psychiatrists treating patients with such kind of difficulties. Dear friends, but its occurrence is worldwide. So the cross-cultural understanding of the illness seems appropriate. As in this gathering, we have several kinds of professionals, but psychologists, psychiatrists, and anthropologists are participating in it. So I would like to emphasize that there is a need for culturally relevant criteria to adopt. So the epidemiology of loneliness and depression is currently receiving considerable attention since quantifying and distribution of any disorder is a major step towards enhancing care. A constant clinical description with consistent definition by which one can label cases of the illness and reliability. Sensitivity, specificity, and validity is required before one can measure the prevalence of an illness. So, dear friends, is loneliness or depression is a mood? Is within quote unquote, dear friends, is loneliness or depression a mood, a symptom, or a syndrome? Does it have static features by which it can be identified? By the relativistic method. By the relativistic method, investigators take into account the ways in which depression is elaborated in various cultures, rather than deny the existence of depression and loneliness in non-Western and underdeveloped area, because the effect may not fit typical Western descriptions. Researchers looked for other manners of distress presentation. The silent features of depressive syndrome, as seen in Western cultures, may not be applicable to the people of other cultures. Ulta Vura, a a renowned researcher named as Olata Vura, states that an explorations within quote unquote, my dear friends, I'm citing here within quote unquote, explorations of the patient's ongoing lifestyle could clarify the meanings each patient's symptoms have for him. Under close examination, psychiatric theory appears ethnocentric as it has developed in Western societies. It is not certain that diagnoses within Western cultures are reliable, sensitive, and specific and valid. When applied across cultural boundaries, criteria must be defined or refined by studying those peoples whose characteristic reactions are denied validity in their own society. So, Margaret Mead, a very renowned anthropologist, she said, she has written on one place that, in quote unquote, no labels, no labels are suitable for all cultures. So, surely this is true for categories of disorders as well. As Sartorius also observed, research methods developed in one cultural settings often prove inadequate or misleading in another, and dangerous must be adopted to conditions in different countries. With changes in training, approaches, and practices for apt extension of Western psychiatry, the way in which an individual experiences a disorder is the crux of diagnostic reality. Diagnostic reality. His experience is shaped to a large degree by his culture with its implicit theories of illness. Inferred from such realities and explanatory models are ideas of the etiology and remedy. Peoples of many non-Western societies are seen to experience depression and loneliness are more somatically than do their Western counterparts. So I can emphasize over here that that since many cases of depression are missed in United States or in India or in the world due to masked presentation, when presentation is of somatic rather than psychological complaints. It is hardly surprising that researchers using Western definition in foreign countries consider the prevalence of depression to be low or non-existent if people in these areas are culturally conditioned to somatize, my dear friends. So here I would like to uh, I, I would like to pass my mic to my another moderator, Dr. Navneet Kaur. But I would like to take few minutes also because there are several studies done in India, Afghanistan, Pakistan, Bangladesh, UK, USA, Japan, China, and several cultures. And it was noted that that the understanding of loneliness and depression should be cross-cultural. Once the cultural realities of depression and loneliness and its allomorphic explanations model have been described, coordinated data gathering and objective analysis can take place across cultural boundaries. Only then can the generic aspects of depression in Homo sapiens be distinguished from its culture specific and algorithms. The recent literature shows bar growing interest by psychiatric researchers as the essential ideas begin to take root and unfold. With care and efforts, anthropological psychiatry may lay follow scientific colonialism and reap a harvest of better diagnosis, care, and outcomes of depressive disorders worldwide. So, my dear friends, time is moving very fastly, very swiftly. I have to say a lot over here, but due to time constraint, I'm also I would like to forward my feelings and my views, and the person who is very devoted in particular fields like Dr. Nawpreet Kaur. She did a lot of works in this particular field. So in this balance and with this backdrop, I hope that she will keep it up. So I would like to invite Dr. Nawpreet Kaur to come and address our gathering. Dr. Nawpreet Kaur.
Thank you, Dr. Udar Pratap. Thank you so much. Uh, you have well defined the terms loneliness and depression. I agree that loneliness and depression is has not any cultural boundaries, and it is beyond boundaries. Every person has faced loneliness and depression in his or her life, definitely. Today's session is about depression and loneliness, the dark corridors of life, which is a very important topic for today's scenario. As we all are aware that loneliness is a universal human emotion that is both complex, unique, and it is I think it has affected almost every person, in every individual. Simultaneously, depression is usually described as feeling sad, blue, unhappy, or something like down in the dumps. Most of us feels in this way at one or other time. But true clinical depression is a mood disorder which is the feeling of sadness, loss, anger for a time period beyond our control. It is for the extended time period. It may be extended for months, for years, or maybe for lifetime. Today, if we talk about today's scenario, everyone is facing such kind of unique situation which we have never faced before. Our way of thinking has all changed totally. We are facing so many obstacles due to coronavirus. It is not in a town or a city or in a country. It is worldwide. It has extended worldwide. So it has affected us worldwide. So in the present scenario, the fear of infection, the fear of death for us, or losing our close one, or pain of isolation, social distancing, it has put so much pressure, so much stress in our lives. It has actually stirred up all sort of feelings. It is important to take care of ourselves. Taking care of our mind is also important. Yes, we have to clean our hands. Yes, we have to think about coronavirus, but it does not mean that we have to focus just on one infection, one or disease, and just focus our life on just one thing. As the focus of our today's webinar is on depression, loneliness. We have read so many news. We have seen the stories of suicide, attempted suicide. If we talk about some cases, especially I just came to know yesterday a case of a journalist who committed suicide due to coronavirus. He was a journalist who was just of 37 years age, and he committed suicide. He by jumping from the fourth floor of the hospital. Sorry, this is a case of almost 1 week back. So when he was admitted in the hospital due to coronavirus, it was observed that although he was recovering well from coronavirus, but was having bouts of disorientated orientation, for which he was seen by some psychiatrists. But there was so much pressure on his mind, he forgot of other things, other important things in his life. Coronavirus, the pressure, the stress covered his mind. He was so much depressed that he took such step which forced him to commit suicide. And we have seen so much similar cases. And because of shortage of time, I'm just passing this discussion to other speakers, and we will continue in between, and I will definitely discuss some other cases with some psychiatrists, some clinical psychologists, and other very well knowledgeable speakers. So first of all, I would like to invite Dr. Suzali Wahab from Malaysia, who is our first speaker for the day. So please, Dr. Suzali Wahab, please join us for the session.
Hi, hello. I am Dr. Suzaili Wahab. I'm a psychiatrist from Malaysia. I'm from University Kebangsaan Malaysia Medical Center. So I have the opportunity to meet you, and I feel very lucky to meet everyone. So I guess the topic for today is about depression and loneliness. I'm just going to share some of my views based on my experiences in treating patients with depression, if that's okay with everyone. Okay, I believe not only in Malaysia, but even in other countries and even in India, there is some difficulty in identifying the symptoms of depression. So depression is actually very common. So globally, as have been mentioned by Prof. Uday, millions of people have been affected. And then it is also the leading cause of disability worldwide. And as we know, among the genders, women seem to be affected more. And what is so important about depression is it can lead to suicide. And it has also been mentioned earlier in this webinar about how a student trainee, a psychiatric trainee, has committed suicide, probably because of depression. So the good thing about depression that I probably want to share is that it is treatable. It is treatable, and symptoms can reduce or remit. So it's not very negative in terms of depression, but how is the approach being given to the patients? Regarding the symptoms, there's always issues because we know already that feeling sad, feeling angry, feeling anxious is part and parcel of normal life. But then when we want to say which one should we focus our attention to, major depressive disorder is the one that psychiatrist is really concerned about. So in terms of having the depressive symptoms, uh, is everyone okay in hearing me? Can you all hear me?
Yes, ma'am, we can
Oh,
hear it.
okay, sorry, because I just want to check my mic. So in terms of major depressive disorder, so the symptoms, as has been mentioned also by Dr. Naprit just now, it seems to be rather more persistent. So it's okay if at one point of time, whenever you have some stress because of being, for example, having some loss or being having trouble with a relationship, there's the emotion tends to be a bit down. But what we are looking forward, or what we are looking at, is actually the persistency of the symptoms. So maybe the awareness regarding the symptoms seems to be a problem in I think in Malaysia is also the same everywhere. So if we are not able to identify the depressive symptoms or depression and see what is the severity like, then there will be a problem in handling the issue, or for example, addressing the possible suicide ideation or intention. So probably what I want to stress is that there are two major symptoms that we are focusing at. For example, the persistency of depressive symptoms, and then the anhedonia, the loss of interest. So, and also there can be some changes in sleeping pattern, and then the weight gain or weight loss that the patient is having. And as often being presented to the clinics, also people tend to have comorbidities with anxiety. So depression and anxiety seems to be really closely connected. So addressing one, we should also be addressing another. So when we want to also see whether the depressive symptoms uh, is actually going to be very severe, we are also looking at the feeling of hopelessness and worthlessness for these patients. So they have, as has been mentioned also earlier, the difficulty concentrating. So this difficulty in concentrating will lead to a lot of problem in terms of functioning, whether be it in work or be it in studies, which can actually lead to the worsening of depression. And possibly one more important symptoms that we need to be aware of, that in cases of very severe depression, the patients can also have psychotic experiences, like experiencing auditory hallucination. So this is very important because I have a patient who is actually trying to commit suicide because of the voices, and she cannot stand the severity of the voices that telling her to commit the suicide. Okay, so in terms of other factors leading to depression, as we all know, it is multifactorial. So we have the genetic factors coming in, whether our fathers, grandfathers, or relatives having depressive symptoms earlier. And then we also have these biological factors. As we mentioned, the role of medication may be related to the biological factors, whereby there's hormones involved, neurotransmitters involved. And there are also environmental factors that we need to be aware of. So I think in the area of COVID pandemic, it is very well understood how loneliness can actually crept in. So we are made aware that we are not supposed to see other people or go out, and people who has been actively communicating with each other find that the COVID pandemic is very saddening, because they sometimes they have no access to communicate with others, especially more so in the area whereby there is no good connection of, for example, internet, because we can, if we are not facing each other through the usual ways of face to face, we can always use the internet as one of the way. But what about these people living in rural areas? Their only connective or communication mode of communication is by with other people that they know of. So this feeling of loneliness can creep in, maybe for months. The condition in Malaysia was, the loneliness era was quite marked in the beginning of the COVID pandemic. But now we are fairly getting to the normal routine again. But I guess in India, it's still the same, maybe. The COVID pandemic is still active, and therefore need to be very watchful about the effect of loneliness and social isolation, as probably one of the main reason why people may take a very drastic role of suicide. So in other words, I feel that we cannot miss these environmental clues or the social cues that we can see in terms of identifying suicidal ideation or possible suicidal attempt. So probably I am interested also to comment a bit on the cases just now, like what Prof. Uday mentioned about the student psychiatric trainee who is actually really committing suicide. So I guess suicide does not really care who we are. Either we are doctors, either we are just normal people. So everyone has the tendency or has the capacity to commit suicide if they have symptoms of depression, or if it is not being attended to. So in a way, awareness regarding how to look at depressive symptoms or how to find out more about suicide, the risk factors, it is very important. And a bit more that I would like to share is just that in terms of treating depression as a psychiatrist, we are looking into a number of model. I agree very much with the previous speakers that it does not only mean that medication is the answer to everything. So if we are addressing the psychosocial cues or the social cues, then the management will be much better. So this is something that we often miss because we rely too much on the medication. Sometimes we think that medication works magic. Well, yes, partly, but not 100%. So in a way, for everyone, it is very important that they are more alert to what are the symptoms of depression, so that whoever is in need or who is showing some form of depression, it is identified very quickly and being referred to the respected professionals. And I think that's all I have to share for now. But I believe as we go along, probably if I have a chance, I will share some more on whatever the treatment or the issues regarding the cases that we're going to discuss. Can I pass to the next speaker?
Okay, thank you so much, Dr. Suzali Wahab. You really spoke excellently and outstandingly, covering all the particular areas like genetic, biological, psychological, somatic, and everything. So your explanations really benefit to Indians and the viewers who belong the other parts of the world also. So I would like to suggest Dr. Navpreet Kaur, please ask uh, another panelist. Okay, I'm doing this. So now I welcome Dr. Adarsh Kohli. She is a senior professor of clinical psychology, Chandigarh, PGIMER, Chandigarh. So, madam, as you have a long and varied experiences of particular field, what we concentrate upon over here, but our viewers all belongs to India, and they are very eager to have and have a holistic understanding about the uh, loneliness and depression. So please address them also, because they are of Hindi belt. So I would like to request you, Professor Kohli, madam, you please, if you can mix the terminology, then our students, our participants would be also benefited. So now, Professor Adarsh Kohli. Professor Adarsh Kohli, are you able to hear? Professor Adarsh
Hello,
Kohli.
can you hear me now?
Yes.
Okay. Good afternoon.
Very good afternoon. Please go ahead.
It's a pleasure to be a part of this webinar, Zoom meeting on loneliness and depression. And I would like to say that these times that we are facing are really unprecedented times. It's once in 100 years that you face such a situation. And with this situation comes forth a lot of anxiety and a lot of low feelings. Normally, a person is facing a lot of low feelings and a lot of fear. Now, in the background of this COVID, we are all feeling that there is a fear, there's anxiety of what is going to happen and whether we might not catch the virus. And if we do, then what is going to be the situation like? So like the previous speaker was speaking, I think a lot has to do with the vulnerability of a person and also the various factors which lead to depression. Since I'm a psychologist, I'm not going to stress upon medications. I think medications is a necessary part of depression, and it is needed once you have severe depression or you have psychotic symptoms like the previous speaker said. But I'm going to talk about mild depression and I'm going to talk about moderate depression. I think a lot has to do with the psychological handling of depression and your other various related factors. As you know, that depression is mainly due to stress, and the stress which is accumulated, which is which has accumulated over the period of time. And when you don't have anybody to share it with, you don't have anybody to discuss it with, you don't have the social support. As you know, these are very strange circumstances when we cannot reach out to people, when we cannot talk to our psychiatrist, when we cannot ring up when we cannot talk face to face with a counselor. We have to just depend upon uh, we have to just depend upon the uh, the webinars or the Zoom meetings or the telepsychiatry kind of methods. We cannot meet face to face, and we miss on lot of emotions and expressions of the patient. There's a lot of limitations of these Zoom meetings because we cannot come to know the real affect of the patient in these. So a lot of factors are related to depression, loneliness, accumulated stress, your frustration, inability to deal with situations, your coping mechanisms, your methods to actually fight it out, your immune system, your health, your mental health, your vulnerabilities, your heightened, your other features, they all will be, will take into account whether you are able to handle the stress or not. So one way is to awareness of the stress and awareness of the depression. How do you recognize depression? How do you really know that one is in depression? It's really important to read the signs of depression. Those who are the significant others, the family members, the people staying with you, they can make out whether you are depressed or not. Because when in depression, you show signs of altered biological rhythms. You have changes in your food, you have changes in your sleep patterns, and you are disturbed. You are unable to concentrate on anything. There may be mental symptoms and there may be physical symptoms. So it is necessary to recognize these symptoms so that you are able to find out that the person is really in depression. And if the person is able to find out that the person is in depression, then one needs to take help. And whether this help, how much this help is needed, whether it is just somebody who gives him social support, somebody who just sits down and talk to him, somebody who will just suggest him methods of how to cope up with that depression, or do you really need to take him to a psychiatrist for help so that medications can be given and the person can be given treatment. So it is necessary to really recognize this depression and to help the person, because suicide is actually a cry for help. Very recently in AIMS, Delhi, we had a resident, I think 2 days back, he committed suicide and he was taking treatment for depression. So if you know that a person is taking treatment for depression and he has already had a history of depression, or there's a genetic basis, or there's a family history, then one needs to see whether the person is really taking medications or not. A recent case in India that we had of a film star who committed suicide at the age of 34. He had left his medications and he felt that he didn't need the medications, and so he was staying alone and there was nobody to help him out. So if somebody could really recognize that he's refusing to take medications and he's not taking medications, one could have convinced him to or taken him to a psychiatrist so that he could be given medications. So there can be various reasons of depression, and some of these reasons may be sorted out at the psychological levels, whereas others would need to be taken to a psychiatrist, or there would be a need for medications. So social support is a very big factor in depression. I think people around you who can really share with you, who can really talk it out with you, who can give you support, and who are there to tell you that we are there if you need help. So these kind of factors really help out in depression and to overcome loneliness. Other things are ways to overcome depression and loneliness, and these only work when the depression is not very severe and when it is in mild or moderate conditions. When one goes into severe depression, then of course medications is necessary. So how do you cope with the depression? There are various ways of coping with the depression, because the more you follow those coping mechanisms, the more you follow that routine, you can get over that depression. How to distract your mind? If you want me to talk about those at this time or later, I'm there to be talking about how do you deal with depression and what are the various methods to deal with it. If you allow me, then I can share some of the techniques of dealing with depression. Shall I do that?
Yes, ma'am, you can go ahead.
Okay. So are we talking about this COVID time, or are we talking about just any time?
Yeah, especially during these COVID times. More emphasis on the COVID times.
Okay. So in these COVID times, I think I have talked about these things, that one has to maintain a normal routine, normal functioning as far as possible. You know, the kind of routine that you had, now that you are at home and you are not following the office timings and all, you have to get up and follow the same routine, like your exercise, your work, and your routine as far as possible. Some of us are going to become more vulnerable because of our innate characteristics, but one needs to be more resilient in this matter, and one has to distract our mind to other things, like what we like doing, like helping in the household, in the things at home, at the, can you see me?
No, madam, we are not able to listen.
I think Dr. Adarsh Kohli has been disconnected.
Okay, then.
No, she has joined again actually.
I have.
Yeah, others, ma'am, you can continue your session.
Okay.
They're waiting. Yeah.
So what we need to do is to follow our routine as far as possible. And though some of us who have who are more anxious and more a tendency to be low will find it difficult, but then some of us are going to be more vulnerable, but others are going to be more resilient. And this resilient, when you are resilient, you have some processes working, and you become more protective and you become more adaptive to the situation. So you have to listen to the experts. You have to practice the methods of meditation, mindfulness, hypnosis, or anything that gives you relief. Social working networks, sites, they are feeding in a lot of information, and you might get negative and information which is not true sometimes. You know, there are some rumors and there's some incomplete information which is coming. So when you are in such a situation, you don't have to switch on the
TV for a long time, and don't keep listening to the information, especially at night before sleeping. And also look up for some authentic websites or news that you can listen to. You have to keep your social networking very active. You can have your video calls, you can have chat with a friend, you can talk, you can make phone calls, and you can now that people have started meeting, I think we have to all start meeting also people, but with a social and physical distance, because we do that with our residents, that when they come and see us, we make them I generally put up chairs in the lawn, and we all put masks, and we sit with a distance, and we put masks, and you keep a distance of 1 meter or 6 feet, and you sit and you talk. So now what happens that way is that you can see the person, you can hear his voice, you can look at him. He's also wearing a mask, you're also wearing a mask, we've all got used to these masks now. So unless you're really sitting close, there's no harm in talking to people and sitting with people. I've heard of people meeting these days, having parties, bringing their own food. I heard that also, that people bring their own food. They have a party, they sit together in the lawn, they put the chairs apart, and they chit chat and they laugh around and they mix and they talk and they, look at each other, and they can, have a look at their friends whom they are missing at sometimes. So if one remains more optimistic at this time, and not entertain any negative ideas or not entertain any pessimistic ideas. We all know that this is a temporary situation, and soon we are going to be back to normal, and that this difficult situation, unless we all join hands and face it, it's going to be difficult. And if we follow the norms and when we follow the instructions, we will be able to tide over this situation, which is of course very peculiar and very unprecedented. So also some people who who believe in a system, certain belief system, can follow their belief system, like praying, like doing their daily moral code. They can, do their daily prayers. If that gives them solace, then anybody with any religion, whether you are a Sikh, you are a Hindu, you are a Muslim, you are any other Christian, you can follow your own prayers and do them morning, evening, and follow the routine. The other thing is your physical exercise. If some of you are interested in physical exercise, then that's a very good way of doing away with any kinds of thoughts. Physical exercise will tune you up and will make you active. They make the brains productive, and they will boost your resilience and your immune system. So best is a good physical walk. Maybe it's just half an hour brisk walk, but at least 6 days uh, in a week, you must follow that walk. Other people can also practice mindfulness or meditation, which is a mental kind of, if you believe in art of living, if you believe in meditation, if you believe in some kind of a prayer or some kind of a relaxation method, you might like to follow autogenic, you might like to follow any other method. All these will relax your mind and also help you to cope better with the situation. So it is a challenge for us, and we all know that it is very stressful, but you know what is the best method that you get relaxed at? Listening to music, or gardening, or stitching, or your hobbies, or your cooking, or your recipes, or reading a book, or cycling. A lot of people have taken to cycling these days. So if you feel that you need to cycle and you will feel good about it, you can start that. So adaptation to the situation is a must. And if we all try and do that and not really get stressful about thinking too much about it and not doing anything, that is going to create a problem. So we have to get out of that nature, sensitive nature, and find out time for ourselves and to sit down with the family to discuss the issues or to share in the household work, so that we can learn to deal with the situation rather than use our problem solving skills, rather than really brood over it and to think that maybe nothing can be done about the situation. I think I'll end here and I'll join in. I haven't really looked at the questions, so maybe I'll have a look at the questions and then come back again. Thank you.
Okay,
Thank you. Thank you, ma'am, for nicely elaborating the problems and as well as the solutions and giving very useful tips. The socializing, of course, is one of the very important thing. And what we can see, what we have experienced, that the so many cases of depression that happens because of non-socializing. So you have very rightly pointed out, socializing is one of the important aspect when we want to get away with that, of course, physical and all. So thanks a lot for ma'am for joining this today's webinar and
Okay.
giving very useful tips. Yeah, and I'll personally thank to you for giving us your student, one of your student, probably you are not aware. She was your student and she is doing very good work with AIMS at our Neurosciences Center. She is none other than Dr. Ashima Nehra. She
Yes.
was your student. I was just interacting with her, and she is doing wonders in that particular field as far as my personal interaction with her goes on.
Okay, that's
So
good.
thanks,
That's
ma'am,
good.
for doing all these things. And please do join. We have got the question answer session in the last. So when the
Okay.
all the speakers will finish, then we will have a whole lot of question answers.
Okay.
So thank you,
Okay.
ma'am. And yeah, may I call upon the next speaker, Somnita, please?
Sir, I would like to call Dr. Hilwa Abdullah, who is a clinical psychologist, the National University of Malaysia. Good afternoon, ma'am. You can take your time.
All right. Okay. Hello. Hi, everyone. Good afternoon. So thank you, Ms. Somnita, for the brief introduction. So my name is Dr. Hilwa Abdullah. I'm also from National University of Malaysia or University Kebangsaan Malaysia, but I am attached as a lecturer in Faculty of Social Sciences and Humanities. And I am also a clinical psychologist by practice as well. So besides teaching, and also I see my patients. So talking about depression, first of all, thank you, Alpha Forensic Science Organization from India, for inviting me and the rest of fellow colleagues from Malaysia to be sharing maybe some experience and knowledge about depression and also loneliness. So this is a very, very interesting topic. As we can see, it's getting hype. It's a sort of, maybe we can say it's a trending pattern if we see in the cases of suicidal rates in globally and also in Malaysia, in my country specifically. So I believe that we have covered a very detailed definition of depression, major depressive disorders like Dr. Suzaili just mentioned about it, the symptoms of how can we diagnose a patient of having this MDD kind of thing, and also before this, the previous speakers, Dr. Adraj Zed, sharing about tips to curb or to face the reality. So it is very, very good indeed. The speakers are superb. So maybe during my session, I will briefly touch on the issue of depression, loneliness among youth, specifically in using this social media. Okay. Like if you see scenario right now, or maybe if we can correlate with our friends or maybe our students, for example, the young ones especially, right? If you see talking about Instagram or Facebook or any other social medias, right? They seems like very lively, very, full of everything is complete life. But have you ever wondered besides that or beyond that or behind all those, happy stories, is there any gap that is missing somewhere? So this is the issue that we need to tackle. So because if it's not everybody that they post everything in the social media, it indicates that they are happy, but some cases it shows that they are doing that to feel that loneliness. Okay, so some cases during last year in Malaysia, if I can share with the audience here in this platform. So last year, about July 2019, here we have a case, an adolescent, a teenager, age 16 years old. So prior to her suicidal, sorry, so she launched an Instagram poll asking her friends, her Instagram fans, to vote whether for her to live or to die. So 69% of her Instagram followers, okay, not necessarily her friends, I believe. So her followers voted voted the girl to die, and then she committed suicide. Okay, so you see the impact, the impact of this. Maybe it's just a joke, because being an adolescent or just like some sort of joke, but to the patient or to the victim itself, it's very, very serious or chronic. So the victim take that seriously, and then she committed suicide. Okay, so it's very important. It's very, if you talk about the impact of social media, so it is very closely correlated with loneliness at the end of the day, depression, and at the end of the day is the suicide rate. And why? If you see the depression rate, it's about, in Malaysia, the last statistic according to National Morbidity Health Survey 2015 is about 10% of the adolescents have the suicidal attempt. Okay, it means it's very worrying. Okay, maybe later on we can share the global statistics in around the world. And then why do most youngsters with depression, they think about suicide? Okay, my experience dealing with youth, with university students especially. So we have a clinic, and usually the clinical cases, they will pass to me, as I am the only clinical psychologist that see the patients in my faculty, in my university in Bangi. So most of the students, they came for referral, and then once they started to share, we take the clinical history taking, and then they started to show the self-harm injury, the non-suicidal self-injury is about 90% of the patients, of the students. I'm talking about university students, age 20 to 23. That is only in university settings. So just imagine in the whole population in our country, in global. So they dealt with non-suicidal self-injury as a sign they want to proceed with the last stage of suicide. Okay, so we know that many of them they think about suicide, they attempt it at one time, they try to attempt, but it's a failure. And if you know that most common methods for those who complete suicide are firearms, they hanged, and then they suffocate themselves, and then they drink poisons and maybe overdose with paracetamol. Okay, I have a patient who is diagnosed with borderline personality. He tried many times to overdose with 20 paracetamols, but God loves him so much, so he still survived. But many attempts of suicide because of he felt that this loneliness, even though he is surrounded by many friends, but still the loneliness, it empowered him at that time. Okay, and then age 13 and 14 are peak periods for suicide. And if you can see what are the causes that leads to this. Okay, the new statistic of National Morbidity Health Survey Malaysia in 2019, okay, our ministry has just released last month in May during the COVID pandemic. Okay, during the movement control order, they just released a statistic of about 440,000 children and adolescents have some signs of mental health issues. And out of that, about 40% of the possible factors is due to peers. See, peers at this age, adolescent, you can relate with peers, social interaction, being bullied, being having that gap, being peer rejected. So those are the factors that contribute to this issue that we are discussing right now. Okay, so because relationship, friendship is is the most top issue for our kids or for our adolescents right now. And how we as an adult or caregiver or maybe a teacher or lecturer or someone adult to the child can regulate their emotions. So emotional dysregulations also is one of the possible factor that leads to this loneliness when their emotions are failed to regulate by their parents maybe. So the long consequences will be they will have this emptiness, loneliness. They don't have someone to share. They don't have someone to listen. So end up they will lead to depression. Okay, so those are the causes. And then you will see it is very earlier this year. I've dealt with one of the adolescent that has committed suicide. She's an taking undergraduate, and she's in terms of religious, she's very religious. So like I agree that Dr. Suzaili mentioned, so depression, it don't know, I mean, it doesn't mean that if you are pious, then you are safe from, you are free from depression. No, no, depression, it doesn't know anyone. Okay. So and then she jumped from the building. So end of his life. Okay, sorry for that. Okay, so a little bit, I think because I'm give psychological treatment for my patients, especially usually my method will be the cognitive behavior therapy. So I believe that if patients adhere to the medications, to any antidepressants, and they are doing well with some psychological interventions, okay, so usually I will use this cognitive behavior therapy to treat my patients. And it is interesting if you deal with patients, right? At the moment they say, at the moment they argue and on any points, they will have we will somehow detect the cognitive distortion. If you see like this is A, so they will somehow didn't see the thing that we saw. Okay, so cognitive distortion, it's one of the main criteria that the patients have. So to modify that, to modify the negative automatic thoughts and negative emotions, so we need to modify the thinking, because when the patients have that negative thinking, that is when they started to, think all over places. So we get back them to focus on what are the behaviors or what are the events that they need to target on. Usually we start with small behavior, and then we eventually we see some positive changes to the patients. Okay, so we are using ABC or antecedent behavior consequences. For you to feel sad, there must be a reason. So it cannot be sad. So maybe some little events, but for another person, it is just like, I can deal with it. But this patient is very serious. So we need to modify the thinking and then know the behavior and what are the consequences at the end of the day. So usually we use this CBT thought record, and then we need the patients to identify what are the situations that makes him or her feel sad or feel lonely. So ask them to write in a diary form. Okay, writing. So situations, maybe I feel so sad that my mom is just like looking at me like this, kind. So we use all those expressive and then verbal kind of approaches when doing this psychological treatment. And then we ask the patients to rate their emotions at that time when they were angry. Usually patients will say about 90%. Okay, and then later on at the end of intervention, we see some reduction of percentage of those negative feelings. Okay, so I guess that's about it for now, because I've touched on it's actually technical part. Maybe we can learn together with Dr. Adash about this technique. It's very interesting, and I find it is effective for most of the patients I handle so far. So with that, I pass it to the moderator. Thank you.
Thank you, ma'am. Thank you, ma'am, for this very interesting session. I would like to call our next panelist speaker, Dr. Hema Priya Jayapal, Director General and Criminal Psychologist, National Crime Investigation Bureau, India. Ma'am, are you here?
Yes, I'm here.
Over to you, ma'am. Thank you.
Okay. Hi, everybody. Are you able to see me?
Yes, ma'am.
Okay, fine. So here, it's very good session that I had seen from the past other speakers. Here, I would like to talk about one basic thing where I had come across from my clients, where stress is nothing but it's an abbreviation which says that situation that releases through external signals or stimuli. STRESS. That is, it's just a gap between the expectation and the reality. So when we expect something and if it is not happening in the reality, we get to go into the depression part of it. This stress extends to depression, and where it also leads to schizophrenia, hallucination, bipolar, and OCD, etc. There are a lot of definitions for it based on the symptoms and details. And especially if you see the basic part of it is what we would like to say is the attention deficit, where the main thing is that we have to look upon the uh, uh, childhood part of it. Childhood part of it, where children's uh, childhood, that is the children who were brought up, the way how they were brought up, and the family background, uh, their trust issues from their uh, parents, and as well as the way how the surroundings is and how they were affected from the childhood, like what the other speaker said, bullying and other stuffs. All these stuffs are put together, actually puts them up into depression. And especially in all these factors, the children or the adolescents or the adults will be like, they'll be lonely. So what they do is that during the lonely time of it, they tend to think about lots of things through assumptions. So these assumptions is definitely will lead to the major part of it, which is actually what we say is called as suicidal thoughts, or they hurt themselves, uh, and they also end their life, which we had seen a lot of suicides. And it's not only it's their intention is just to try, but to end their life. So what we need to do is that if they had already attempted, we need to ensure that we give a proper counseling for them. CBT will work out to a greater extent, and as well as if you see, meditations will work to a certain part of it. But since because they do have a lot of running thoughts in their mind, meditation may not be much helpful at times during the critical situation. But a wide angle vision will definitely help them to work out. The physical activity part of it is we need to mainly concentrate, where if we actually give them a good physical activity and the surrounding people, and we need to mainly concentrate not only with the client or the patient, but also the relatives who actually coordinating with the client. That is, when we actually counsel the client or the patient, we actually counsel even the relatives as well. That is, parents or the spouse or the children. So we actually give counseling for them as well in order to help them to come out of it. So it's like a family session. So we have to ensure that that person is not left alone at any point of time. And moreover, if you see, medications will ensure that it will control the uh, sensitivity part of it, but it cannot be cured completely, but it can be controlled. But the curable part is mainly on psychological sessions that we actually give, therapies that we give. So both psychiatrists and psychologists both put together, ensuring that it's a teamwork. So it's not only depending on the psychiatrist, or it's not only depending on the psychologist. It's a teamwork, it's a group activity where to ensure that the person comes out of it, which is very important. So let us also ensure that and we have to ensure the feedback once when we start uh, okay, whether mental instability is due to lack of some, okay. See, mental stability may not be stable for the people who are under depression. So they have, as I said, they have running thoughts. So definitely if you see during the time of running thoughts, they will not be able to handle one situation at a time. They'll be doing n number of thinking in their mind, and which is actually uh, what we say is that maybe out they will not maybe they'll be out of the thing, out of the box. They'll be think about lot of things, and they'll be what we say is, yes, they'll be thinking that extreme part of it, extreme level of uh, extreme level of thinking, what we would like to ensure. So the main thing is that we have to ensure that their extremity should be controlled in such a way that core activity should be avoided. Especially if you see most of the suicidal thoughts people are having the habit of doing core activities like using of gadgets, watching TV, or doing one specific activity only, like reading books, too much of books. Anything that they do is like an extreme level. So what they do is that anything which goes in extreme, which goes for a toss. So we have to ensure that whatever that we do, we will do it in a normal way, and in all the way, in all the work, we have to give it a normal, equal importance to it. We have to participate in all the activities. It's not only one correlated activity that we need to do, and we have to ensure that after 8:30 we have to stop the correlated activities. So, and physical health is also very important, because that also makes us to improvise our mental stability as well. So all these put together will make us our psychological thoughts in a good way. So this is how I would like to say upon it. And yes, I would like to pass it on to the next speaker. Thank you.
Thank you, ma'am. Now I would like to call upon Dr. Zuriati, psychologist, UCSI University, Kuala Lumpur, Malaysia. Ma'am, are you here with us?
Yeah, I'm here.
Over to you, ma'am.
Okay, thank you. Okay, all right. So hello, everyone. Thank you so much. Okay, first of all, thank you so much for inviting me to be one of the panel in this very interesting Webiloque. Okay, so before that, let me introduce myself first. Okay, I am Dr. Yati from UCSI University, Malaysia. Actually, I'm teaching psychology courses for undergraduate and also postgraduate students. I'm also the head of program for Master of Clinical Psychology and Master of Child Psychology in my university. So before I continue the session, let me introduce to you about positive psychology. Okay, positive psychology is one of the branch in psychology where it emphasizes the study of positive emotion, the personal strengths, and also skill of the human being, as well as the positive institutions such as family and community, where they allow us to experience an expression of positive emotions, where it enhances our mental health and also promote wellnesses. So basically, positive psychology focuses on the positive events and also influences in life, including positive experiences like happiness, joy, inspiration, and love. Another one is positive states and also traits, which is including gratitude and also resilience. The third one is positive institutions such as family and community, where applying positive principle within entire organizations and institutions. As a field, positive psychology spends much of its time thinking about topics like character strengths, optimism, life satisfaction, happiness, and well-being, and etc. So, since today's topic is related to loneliness and depression, let me explain about loneliness first. Okay, basically loneliness is defined by people's level of satisfaction in their connectedness or their perceived social isolation. Connectedness is including the people where we are dealing with and also the event that we are experiencing. Loneliness is a universal human emotion that is both complex and unique to each individual. It is an experience that has been around since the beginning of time, and we all deal with it. It's something every single one of us deal with one from time to time and can occur during life transition, such as the death of a loved one, a divorce, or a move to a new place as well. Even some people who are surrounded by others throughout the day or are in a long-lasting marriage still experience a deep and pervasive loneliness. Some studies suggest that loneliness poses serious threats to our well-being as well as long-term physical health, which is something serious and we have to look into this. In order to understand loneliness, it is very important to take a closer look at exactly what we mean by the term lonely, as well as the various causes, health consequences, symptoms, and potential treatments for loneliness. While common definitions of loneliness describe it as a state of solitude or being alone, loneliness is actually a state of mind. Okay, loneliness causes people to feel empty, alone, and unwanted. People who are lonely often crave human contact, but their state of mind makes it more difficult to form connection with other people. Loneliness, according to many experts, is not necessary for being alone. Instead, if you feel alone and isolated, then that is how loneliness plays into your state of mind. A lonely individual's higher risk of ill health likely stem from several combined factors, such as behavioral, biological, and also psychological. Lacking encouragement from family or friends, those who are lonely may slide into unhealthy habits such as addiction and also aggressive behavior. Among older adults in particular, loneliness is more likely to set in when an individual is dealing with functional limitations and has low family support, better self-rated health, more social interaction, and less family strain reduce older adults' feeling of loneliness. However, how to fight depression and loneliness, especially during this pandemic? Number one, we can do something or we can do anything that we like. Okay, maybe we can spend more time with our family. We can start our new daily routine. Maybe expression, while through writing diary, something like that. And also bond with a pet. This is proven by many studies where it says that pets, especially dogs, are protective against loneliness. There are many reasons why this strategy works. For example, dogs get you out and about. They are naturally social creatures and you will have a living being to care about. Other pets such as cats and fish can also help ease loneliness. Next, think beyond yourself, where depression can make you feel very self-focused, meaning that everything is all about you. But remind yourself that if you ask a co-worker to join you for lunch and the person can't make it, you should not automatically assume that he or she has rejected you. But the person might have a previous lunch date or too much work to leave his or her desk. Next is make time for relationship. Everyone is busy, but relationship won't wait until, for example, you have finished your PhD, raised your kids, snag the next big promotion, or move to your ideal city. So we have to build them out. So no one on their deathbed wishes they had worked a few more hours. Next, last but not least, mindfulness. Mindfulness teaches us that we are more than who we think we are. This is what said by Jeffrey Greason, one of the assistant professor in Duke University Medical Center. So developing a meditation practice can help us to identify and release some of the thoughts that could be keeping us feeling lonely and undermining our efforts to meet new people. This is the tips that I share with you just now is just general tips how we can fight with the depression and loneliness during the pandemic. But now I will focus on how can positive psychology help in the treatment of depression. So there are 5 core elements of psychological well-being and happiness. So these 5 elements are believed can help people work towards a life of fulfillment, happiness, and meaning. What are the 5 core elements that I'm talking about? Number 1, it is a positive emotion. So this element is perhaps the most obvious connection to happiness. So focusing on positive emotion is more than smiling. It is the ability to remain optimistic and also view one's past, present, and also future from the constructive perspective. So a positive view usually will be able to help in a relationship and also work and inspire others to be more creative and take more chances. So in everyone's life, there are highs and lows. Focusing on the lows does increase your chances of developing depression, although the equation for depression is very complicated. Regardless, there are many health benefits to optimism and positivity. Number 2, which is engagement. Activities that meet our need for engagement flood the body with positive neurotransmitters and hormones that elevates one's sense of well-being. So this engagement helps us remain present as well as synthesize the activities where we find calm, focus, and joy. So usually people find enjoyment in different things, whether it is playing an instrument, playing a sport, dancing, working on an interesting project at work, or even just a hobby. So we all need something in our life that absorbs us into the current moment, creating the flow of blissful immersion into the task or activity. Number 3, relationships. Relationships and social connection are crucial to meaningful lives. Too often, the pursuit of happiness has this Western bias of individuality, where each person steers their personal happiness ship to store. This is not realistic. We are social animals who are hardwired to bond and depend on other humans, hence the basic need for healthy relationships. So positive relationship with one, parents, siblings, peers, co-workers, and friends is a key ingredient to overall joy. Number 4 is meaning. Having an answer as to why are we on this earth is a key ingredient that can drive us toward fulfillment. Religion and spirituality provide many people with meaning, as can working for a good company, raising children, volunteering for a greater cause, and expressing our self-creativity. Unfortunately, the media worships glamour and the pursuit of material wealth, impacting many people to feel like money is the gateway to happiness. While we do need money to pay for basic needs, once those basic needs are met and financial stress is not an issue, money is not what provides people with happiness. Last but not least, accomplishments. Having goals and ambition in life can help us to achieve things that can give us a sense of accomplishment. You should make realistic goals that can be met and just putting in the effort to achieving those goals can already give you a sense of satisfaction when you finally achieve those goals. A sense of pride and fulfillment will be reached. Having accomplishment in life is important to push ourselves to thrive and flourish. So I think that's all from my side. So I pass it to moderator. Thank you.
Thank you, ma'am, for those wonderful steps that you've mentioned. I would like to call upon Dr. Asha Srivastava, PSO and HOD, Department of Forensic Psychology, Central Forensic Science Laboratory, CBI, New Delhi, India. Ma'am, are you here with us?
Good afternoon, everyone.
Over to you, ma'am.
Yeah, thank you. First of all, I want to give thanks to Dr. Adaj Kumar and this Alpha for inviting me to share my views on here. And as you know, I am my expertise in the field of forensic psychology. But before that, I am psychologist. So I'll share my views and especially I will focus only this COVID-19 pandemic, this time, this pandemic time, COVID-19 pandemic time, the teenagers, youngsters, how they are feeling and how the depressive thoughts are coming. Recently, you have seen that one TikTok girl, she committed suicide. So she was a teenager. So I will focus mostly at the time of this COVID-19 pandemic situations, how the teenagers and youngsters, they can prevent their depressive thoughts. So it's a time, a crucial time. It's a difficult time for everyone because we get to know more about the expansion of COVID-19 around the world through different multimedia. For example, from TV, newspaper, social media, family and friends. And we all know that everyone is affected by this COVID-19 pandemic in different ways. Only one person is affected, everyone is affected. So some people are experiencing more psychological distress as compared to others. And they need support and help for managing their distress. In these situations, every person is facing some problems, some psychological distress, and they need help from their different peoples just to help them. So some people, the most common emotion faced by everyone is fear and anxiety. You will see. Mostly every person is facing the problem of this fear and anxiety. And teenager cannot, just for example, you will see nowadays teenager, they cannot celebrate, they cannot meet their friends, बाहर से कुछ खा नहीं सकते, बार-बार उनको hand wash करना है. So because of the fear of coronavirus, so this will develop different type of fear and anxiety in the mind of the teenagers. So in these situations, how they are facing some depressive thoughts कि मैं अपने friend से मिल नहीं पा रहा हूँ, मैं बाहर जा नहीं पा रहा हूँ, घूम नहीं पा रहा हूँ. So many depressive thoughts will come in the mind of the teenagers. So during lockdown, it has isolated physically, but we have felt isolated mentally. So depression is a very serious mental health condition, and that can have a significant effect on people's life. So there are, as our previous speaker also explained about that depression is a serious mental health condition, and there are mainly two causes of depression, either biological or psychological. As a psychologist, I feel that the psychological percentage and self-created, it's a more percentage in comparison to biological. So for any person, if he has any biological reason, so they have to consult the psychiatrist. But for psychological reason, but for this depression, we have to work at both biological and psychological levels to remove our depressive thoughts. So how we can remove our depressive thoughts? This is the main issues. How we can, because many thoughts are coming, and the teenager, they are not eating, not going outside, मन नहीं लग रहा, पढ़ाई में नहीं है, depressive mood में बैठे हुए हैं, frustration है, झगड़ा कर रहे हैं, many things are there. So how we can remove our depressive thoughts? So many psychological cause of depression is you will see. So mainly psychological cause of depression is major amount of intense emotion and thoughts, but in wrong direction. As a psychologist, when I discussed this issue with 2-3 students, they were telling me that this depressive thoughts is coming because of this reason. They are telling me the reason also. Okay, because of this reason, मुझे depressive thoughts आते हैं. So मैंने उनको बोला, when you know the cause, it means you are capable to remove your depressive thoughts. Because when you will discuss with any students, any teenager, any persons, when he is explaining you about the cause of depression, it means that person is capable to remove depressive thoughts. So there are, as Madam also explained some tips. So I am also telling you certain tips one can follow to overcome these depressive thoughts. So first of all, identify your negative thoughts. This is the main thing. Firstly, every person should be able to identify their negative thoughts and try to find out the alternate explanation that also. That is very much important. So you just a paper pencil लो and write down करो कि मेरा क्या negative thought आ रहा है, क्यों आ रहा है, और इसका alternate explanation क्या हो सकता है. Suppose एक आदमी जा रहा है, आपको रास्ते में मिला, उसने greeting नहीं किया, correct? अब वो person ये thought develop कर लेता है कि he doesn't want to talk me, he doesn't want to communicate with me, and because I am not a good person, I am not a nice person, so he will started feeling guilty for himself. In the same way, in the alternate thought, अगर वो सोचता है, मान लो कि वो आया, हो सकता है उसने मुझे देखा ही ना हो, इसीलिए उसने मुझे कोई reply नहीं किया. So no negative thoughts will come. So first you identify your negative thought and try to find out the alternate explanation also, because you can do yourself. For that, you are not required to any other person. Secondly, focus on scientific thinking. Means everyone must accept the reality in the way it actually is. We are not accepting the reality. इसीलिए depression हो रहा है. We are thinking something different. We are not accepting the reality. So this is because, so focus on the scientific thinking. So everyone must accept the reality in the way it actually is. One should be always connected with their family and friends, keeping themselves busy of their hobbies, groom yourself, getting physical activities, staying healthy. So social contact is very much important. If your movement are restricted, means keep in regular contact with people close to you by telephone, by video calling. You can connect your people, because social distancing doesn't mean social isolation. So reach out and check in regularly with people you care about. Make that phone call, video call, or send a text message, WhatsApp message, be part of social media, community group. So at present, I think youngsters are more sound technically, so they can try to help older people also by talking to them, providing any information related to them. In this way, you will get some tasks to do from home and you will feel very happy. So be kind to others. Have a routine. This is very much important. This at the time of this lockdown, this situations, you maintain your routine. Get up and go to bed at similar times every day. Keep up with personal hygiene. Eat healthy meals regular time. Exercise regularly. Allocate time for working and time for resting. Make time for doing things you enjoy. So one thing is very much important nowadays, because every teenage and youngster, they feel their happiness should not, every time everyone should feel that one's happiness should not be depend on anyone. Their happiness should be within them. It all begins and ends in your mind. So don't let your happiness depend on others. Learn to be alone. Love yourself at this pandemic situations. So one should try the anxiety reduction technique also, as Madam earlier also explained about the anxiety reduction technique, which is relaxation methods like deep breathing, mindfulness, meditation, brief muscular methods. So can help in reducing anxiety. And one should focus on yourself first. This is the very thing this time. For example, one thinks that no one is paying attention to them and not giving enough affection to them. So, but firstly, they should think about the attention they are giving to themselves, because it's very important to love yourself first, then anyone else. If you love yourself, you pay attention to yourself, you care about yourself, then anyone's attention or affection wouldn't matter to you. Your greater responsibility is to love yourself and to know that you are enough. Think technique. This is very much important. First you think, you check your thought. If it is true, it is not true, it's helpful, it's inspiring, it's necessary. If your thoughts are not helping you to solve the problem immediately and increase your worries and anxiety, it's better not to give much importance to your this type of thoughts. And next, media consumption on COVID-19 should be limited. Every time you are listening, this number increase, that can create that tension. So restrain watching news and managing the information intake and mindfulness use of social media. Stay informed about COVID-19 through reputable sources such as UNICEF, WHO, and National Health Ministry advisory. And you find source of comfort. You are at home, so you find source of comfort. Finding ways to give yourself comfort, even when you are feeling lonely, can help to improve your mental health. So there are some ideas of comfort measure. You can take a bath, you can do foot massage, you can focus on your pet, you can cook healthy and comfort food, watch favorite TV show, you read favorite books, have a cup of herbal tea, you like scented candles, practice sleep hygiene to make sure that you are getting enough rest. Create something that is also very much important. You do painting, writing, dancing, etc. Your writing projects, right? If you are students, you should write some article in general each day. You can improve your writing also. You start a daily blog generalizing your experience for others to read. You can write poetry, you can write short stories, whatever you want, you can do something. You can do some art project, complete a paint by number project, start a needlework, knitting work, anything work, complete a photo album that you can share later with your others. You can work on coloring books, take a new hobby. You have many hobbies, so you rediscover your hobbies. You can do some home project. Choose a space in your home and start an organizing project. Choose a room in your room in your home and redecorate that thing. You could even focus on cooking or baking projects or different things. And main thing, you apply the distraction technique. This is very much important. Another way to boost your mental health is to find healthy distraction. Distraction technique engage in activity that makes you happy. This might come in the form of reading, watching shows, rediscover your hobbies, listening to music, or finding other activities that interest you. So there are some ideas you can read. Go back and reread some of your favorite childhood books. Join an online book club. Give yourself a reading challenge by choosing a list of books you have always wanted to read. Read books of poetry if you find it too hard, so concentrate on longer books. Read magazine on topics that interest you. So listen to audiobooks, watch TV, movie, and you can plan the future. Plan for the future. While it might feel like this loneliness will last forever, there will become a time that you will back to your usual time routines. So one way to feel less alone now is to make plan for the future or do things that help you to focus on the future. There are some ideas. You can make a future list that things that you want to do. You can order online, plan something. You can do the gardening also. You can plan a fun event. You can make a list of things to do in your lifetime. You can make a goal list for some area of your life. And what to do if you are feeling lonely. Immediately you start to call your friends, family members, health professional, a counselor to talk about your feelings. So nothing is permanent in this earth. When we had a good time, it is gone, and then this bad time will also be gone. So we will meet with people again and we will do the party again. So stay safe and healthy. Thank you.
Thanks, Dr. Asha, for sharing your views and accepting my request to be the speaker. And as you rightly pointed, you are first a psychologist, then a forensic psychologist. Dr. Asha, I can say she is the #1 forensic psychologist at present in India. We have been associated on so many, sorting out so many criminal cases. That's what we came into contact with each other. And her help when we are discussing about certain crimes, sorting out certain suicides, especially when there is a controversy between suicide and homicide. So all these, you can say, psychological inputs, these come into picture, and they were very helpful in sorting out the many cases. And of course, what the tips she has given to all of us today, I think they are excellent. So now, from the beginning, we have covered the speakers from the various fields like clinical psychology, positive psychology, and a forensic psychologist view. Now I think it's time to turn over to the other side of the, you can say the other side of the story, that is from the legal point of view. So now we have got the speakers, the legendary speakers from the law field, who will be sharing their views in this particular context. I'll request them to just restrict it to maybe 5 to 7 minutes, because we are already lagging behind much of the schedule. And I can see the chat box is full of questions. In the meantime, I'm just compiling all those questions, trying to just compile everything. So with this, I request the moderator to please invite the next speaker from the law field. Thank you.
Thank you, sir. Now I would like to call upon Dr. Soumya Kumar, Assistant Professor, Department of Criminology, Karunya University, Coimbatore, India. Ma'am, are you here with us?
Yes.
Over
Can
to
you hear me?
Yes, ma'am.
Okay. First of all, I would like to thank Alpha Forensic for inviting me as one of the panelists. Yes, is it visible? Yeah, okay. I'm Dr. Soumya Kumar, criminologist from Karunya University. So being a criminologist, I would like to share my experience of research and discuss depression from criminological perspective. So even during this COVID situation, people face depression, which leads to deviant or criminal behavior. When we talk about depression, depression not only leads to suicide or harming themselves, but it also makes a person commit crime or involved in various antisocial behavior, harming others. So suicide is an inward violence without physical victim. Crime usually involves outward violence with physical victim. Here I have taken depression as two aspects. First, I'll discuss about the association of depression and crime, which leads to deviant or criminal behavior, under which I'll also discuss the depression leading to suicide of crime victims and depression associated with murder cum suicide. The other aspect I'll discuss about depression after the commission of crime. That is prisoners who face serious mental health problems, particularly depression. So depression is faced before the commission of crime and also after the commission of crime. First, depression leading to deviant or criminal behavior. There are various studies that found individuals with depression symptoms and chronic depression show high level of deviant or criminal behavior. So people experience depression in different ways, and there are various reasons for this depression, which leads to commit crime. So what are the reasons for this depression? If we see, mainly I can highlight family as one factor. So individuals who have negative relationship with family, like broken family, conflict within the family, or child with single parent, lack of love and support in the family. So these individuals have high level of depression, which leads to deviant behaviors. Deviant behaviors like school delinquency, including poor academic achievements, truancy, school dropouts, and the other seeking love outside, which leads to teenage pregnancy, eloping. This seems to be more prevalent among adolescent girls, that is teenage pregnancy and eloping. And next is sexting. Sexting seems to be higher in youth. Sexting, as we all know, it's like chatting, but here they exchange sexually explicit content like porn videos, nude photos using technological devices. So to avoid depression and loneliness, mainly the youngsters find friends in social networking sites. So first they give friend requests to strangers, then chat with them and start sexting. So sexting is considered as a very risky behavior, which may further lead to crime like bullying, revenge porn, and other type of online crimes. So if a girl sex with problematic partners who further sex with their friends or others, these girls are more likely to be victimized. Here I have to mention a case where a recent case of 16-year-old girl who committed suicide in Gujarat, India, after her boyfriend leaked their intimate videos to their friends. So the friends, they circulated it further. The girl, after knowing this, she was very depressed and she ended her life. So in this case, depression is associated with suicide of crime victims. And the next is depressed adolescents also attract deviant peer groups, which may lead to substance abuse. Substance abuse like smoking, drug abuse, alcohol addiction are prevalent among hostel students, which includes both boys and girls. Also associated with deviant peers, individuals involved in vandalism. Vandalism is nothing but damaging the public property. This we can relate to the US conflict, that is most of the peoples, because of the lockdown situation, they damaged the properties and involved in various vandalism activities. And the other is public disturbance like drunk or causing nuisance in public places. These were all seen among the depressed adolescents. And poverty, financial stress also creates depression. So to achieve financial security, individuals involved in shoplifting, minor theft, drug dealings, etc. Best example is college students selling drug to their peers for pocket money. And the next I would like to discuss about murder cum suicide. So the researchers has found that depression also leads to violent crime, where the depressed people also involved in violent crime more likely when compared to the general population. So the violent crimes like homicide, robberies, and sexual offenses are also committed by the depressed people. One of the main crime associated with depression is murder cum suicide. This murder cum suicide is nothing but when a person commits a murder and then commits suicide. So there are various murder cum suicide cases. Here I would like to highlight two cases where one we call it Usuri case, which is more prevalent in down south of Tamil Nadu. In Usuri case, depression happens due to poverty, which leads to murder cum suicide. Usuri is nothing but lending money from money lenders at an unreasonable higher interest, that is considered unlawful. So the poor middle class insulted and leads to depression and further results in murdering of the family members by the breadwinner of the family, and finally he commits suicide. And the next case is honor killing cum honor suicide, where here when a woman brings bad name or dishonor to family by marrying someone of lower caste, to maintain the purity of the caste, the parents murder the couple and then they commit suicide. So depression is associated with murder cum suicide cases. So finally, I'd like to discuss the I'd like to discuss the depression after the commission of crime, because here I would highlight the condition of prisoners, because prison is also a part of a society. So after a person is convicted and imprisoned for a particular crime, inside the prison, the convict or the prisoner face serious mental health problems, particularly depression. So the reason for depression and other mental health problems in prison are mainly social exclusion. So when compared to men, women are totally neglected from the family. They don't have contact with the outside world. This creates depression in the minds of the prisoners, and stigma is also one of the reasons for depression. Longer the prison sentence, severe the mental health problems of the prisoners. And the last is closed confinement also is a reason for depression. So without contacting the outside world, so this we can relate to our current lockdown situation. Just imagine we cannot stay inside our home with all the facilities for even a month or two. Imagine how a prisoner will be in the prison. So inside prisons, self-harm and suicide are more prevalent among first-time and situational offenders during early stage of imprisonment. And later stage, they get adapted to the situations. But mental health problems are like depression, frustration, stress are severe among the prisoners who serve long-term imprisonment. Mental health of prisoners are least sorted out by at psychological level, like counseling. And that is why the prisoners are engaged with other type of activities like education, occasional training, etc. But meditation really works in prison. Meditation and yoga practices are practiced in prison, and that really works. So what are the measures to prevent these type of deviant or criminal behavior? So first we have to identify the cause, and cause should be identified, and according to the cause, treatment should be given. And youth should have a positive family and peer group relationship. And mostly we have to accept and adapt to the changes in the society. And youngsters, they have to learn how to deal with failures. And they have to get to know themselves and don't try to imitate others, or most of the youngsters now are very attention seeking. And the mindset of the individuals can be identified by the post or the status they can share in the social networking sites, which can lead to further victimization. So that can be avoided. So this is about the depression from my, as a criminologist, from my point of view. Thank you. Over to the moderator.
Thank you so much, ma'am. Now I would like to call upon Mr. Askari Hussain Shakti, Certified Barrister, Bar Standard Board, London Senior Advocate, Supreme Court of India. Sir, are you here with us? Sir? Sir, are you here with us?
Yes, Somnita, he is available here. Just wait.
Yeah. So, namaste for my Indian members and salam for my Malaysian members. So, I am here to discuss on the suicide. I mean to say that if you talk about the criminology, so suicidal attempt is a crime, but suicide is not a crime. So, I do agree with the previous speaker, Sumaya. So because under section 309, the punishment of 1 year, that is the simple punishment, that is not grievous imprisonment, that is simple 1 year punishment for attempting suicide. So I think in India, it is there is provision for committing, if the person is committing suicide and they could not commit the successful attempt. Only in this situation, there is the section that's called 309. By this, the Indian Penal Code can attack, and the person can punish with the imprisonment. If the person is successfully commit the suicide, so there is no punishment. As we know that if the person is attempting the suicide and he do success in this crime, so there is no crime. And there is another section that's called 306, that is for abatement of suicide. Abatement means if the person is doing something and the other person who is listening this kind of things, and they the person think about that the life will not be good for me in this situation, in this kind of situation. Nowadays, the COVID-19 situation is going on. So there is also social distancing. The word is social distancing, but I do not agree with the word social distancing, because this is not social distancing. It is physical distancing. So most of the people are saying that this is social distancing. We are here, we are the social person, so we are here. So we need to establish the social relation, and we need to maintain the physical distancing. So social relation is very important. If we are not in social relation, if we are maintaining the distance in between the person to person, it will not be good. So I think this kind of atmosphere is forcing the youngster peoples to commit suicide sometime, because we are human. So we need to be live together. We need to be talk together. So according to me, nowadays the COVID-19 situation is going on. So we could not maintain the physical distancing. Sorry, social distancing. We could maintain the physical distancing only. We are here, we are talking online, we are on social media. So social networking and social relation is very important according to me. If we talk about the legal aspect of the suicidal attempt, so I think suicidal attempt is punishable offense, because numbers of people think that if we will commit the suicidal attempt and we will not success in that attempt, so in this kind of situation, the person can think that we will be behind the bar. So I think this section is good for India, because numbers of people think about this, about that. But if we will talk about the Indian courts, including my Supreme Court of India, so there are numbers of cases in which the court decided that the section 309 is constitutional, and in some cases the section 309 is unconstitutional. So there is two type of views. There are two types of thinking. In some cases, as I remember the case of Ram Sundar versus state. So this case belongs to an suicidal attempt. In this case, the court decided that if the person declared that that we will not take a single glass of water till the death, until the death, then it is this kind of situation and this kind of commitment will be the threat of attempt to suicide. Because if the person taking oath like this, that we cannot take a single thing, we cannot take a single glass of water until my death, so it means he is on the way of suicide. So the court decided that in this kind of threatening is also attempt to suicide. So sometimes the person think that if we take poison, so in the case of poisoning, sometimes the people think that we are going to commit the suicide. But if we are threatening that we will commit suicide by doing this, by doing that, so the person don't think about this, that we are also committing the suicide. So in that case, the court held that this kind of threatening is also like to suicide. So the person have, in this case, the section 209 has been rejected, and the court have decided that the person is liable to be proceed under section 309 of IPC. There are numbers of cases which has been decided by the Supreme Court of India and the Bombay High Court. Another case is in my mind, that is Maruti Shripati versus State of Maharashtra. In this case, there is constable. So that constable used the kerosene oil and apply the kerosene oil for committing the suicide. So in this case, there was Bombay High Court, and Bombay High Court had decided in this case that the Article 21, there is Article 21 of Constitution of India. So under the Article 21, all the Indian citizens, because the Indian Constitution talk about the Indian citizen, so all the Indian citizens have right to live. But in some cases, the court decided that there is also life to die. If the person have right to die, then all the person can anytime can commit the suicide. So there is, if the court allow this kind of thing to the people under Article 21 of Constitution of India, so no doubt numbers of people think that there is no offense, so we can commit the suicide. That is my right. So I think this kind of thought is not good, but sometimes the court think that this kind of thing, if the person is not happy with the life and the person want to die, then he will be free to die. But in this case, in Maruti Shripati case, the court decided that Section 209 is unconstitutional because the person have also right to die. But after that, in some cases, the Supreme Court decided that the Section 309 is constitutional. That is not unconstitutional, because the right to live is under Article 21 of Constitution of India. But the life is not my life is not my own, because the state have also the right on my life. So this kind of thought, when the Supreme Court held that this kind of things, this kind of situations is going on in my country, numbers of cases are coming before the court, and there are numbers of accused who have committed to suicide and who have attempted to suicide. There are also my client who take the poison. And there was a case registered under Section 309 of IPC. That case also belongs to Lucknow. So in that case, when my client released by the hospital, and when after that the police came to arrest at the home of my client, because my client have committed my attempt to commit the suicide. Then she called to me that this kind of situation is going on with me, because after this kind of mental disorder, when I need to recover myself, that then the police is at my door and the police want to arrest me. Then I think that this kind of legal system is going on in my country, but that is not bad, because on that time, I think that it is okay that there is Section 309 IPC. In that section, the police have right to register any first information report against any person who have attempt to commit the suicide. But it is not just good, because if the person have committed suicide, so it means there is there is big burden on the mind of that person, and the person do not want to live here in this world. So it means the person do not want to be behind the bar on that time. The person want to be medication on that time. The same thing has been decided by the court. That case was, as I remember, that is BP Sawant. There was the Justice BP Sawant, and on that case, Justice BP Sawant decided that if the person has commit the attempt to commit the suicide, so he do not need to be behind the bar. He need to be medical treatment and psychiatric treatment. So I think this kind of thinking, which Mr. Justice BP Sawant adopt that in the judgment of this case. So I think the section 309 is constitutional in India, but I think all the time in these kind of cases, which is attempt to commit the suicide, this section cannot be this section cannot be applied on that time when the person is aggrieved, when the person is not happy with the life. And after that, I think there can be some changes that after that, because this section is also cognizable. Cognizable means the police can arrest without the warrant of the court. So police have right to arrest the person who have attempt to commit the suicide without the warrant. So I think this kind of provision is going on in India. But if we talk about some other cases, in some other cases, court have also uh, held the views, and sometimes that okay, this kind of thinking is good. But in other case, if I talk about the other case, that is Sanjay Kumar case, that is belongs to Delhi High Court. In that High Court, the court have decided that this kind of thinking which going on in my country, that the people who have attempt to commit the suicide and then after they must be punished. So I think this kind of punishment which is mentioned in the section 309 is not fair, because the person is also want to die, is also want to finish himself or herself. So in this situation, I think they need psychiatric help and medication. This kind of people do not have to be behind the bar, as I think. But the section 309 is fully constitutional, because the Supreme Court has held that this section 309 is fully constitutional, that is not unconstitutional. So being a lawyer, I do agree with this, because apex court have held that the section 309 is totally constitutional. So I think there can be some other provisions, or some other exceptional class may also be described in this section, because sometimes it's happened that when the person do not want to live and the police want to be arrest the person, and it is not a good law, I think. So the person, if the people have right to live, so why the people have not right to die? So I think both the right is equal, because it is my life. Whenever I need to die, so I can be die. So I think, according to me, the section 309 is made by the made by the Britishers, and they think that sometimes it's happened, and sometimes the people attempt this kind of thing and threaten to others. Sometimes while threatening to others, if the husband will not do this kind of things, that kind of thing, so wife will commit the suicide. So sometimes this kind of situation will also become on that time. The section 309 is right. But there is also a section that's called 306, that is the abatement of suicide. That is the right section, and the imprisonment part of this section is about 10 years. So I think this section is good for criminal who are doing this kind of thing, who attempt this kind of crime, that's called I think abatement of suicide. So I think my time is going to be over. So we need to be called the next speaker. It will be good. It is very big thing if we will discuss about the suicides, because there is a question of a life. So the 15 minutes is not a sufficient time to discuss over there in this subject. So I think please come the next speaker online. So thank you.
Dr. Asghar Hussain, thank you so much.
Yeah.
You have really showed us the scenario, legal scenario of suicide, especially of euthanasia. I just want to add on into your talk that in March 2018, passive euthanasia in legal Indian, the Supreme Court added some strict guidelines that patient must consent through a living will and must be either terminally ill or vegetative state if he wants to go for
Yeah,
euthanasia. So thank you so much for adding your legal knowledge
thank
to
you.
this this Webiloque. And moreover, as you said that this is not physical, this is kind of physical
Physical distancing.
distance. Yes, you are very
Yeah,
much right over here. Just it just means that we need to adopt how we connect with the people in new
yeah,
way. So thank
exactly.
you so much for your
Thank you,
very
everyone.
kind words. I would like to request Somnita to invite the next speaker.
Yes,
Oh,
ma'am.
thank you so much, thank you, everyone.
Thank you, sir.
Okay, thank you.
I would like to call Miss Tia, who will be delivering her own personal life experience that she has faced. Ma'am, are you here with us?
She's right. She's right there on the screen. I can see her. But I request
I'm
you.
unmuting. Hi,
Yeah.
can you hear me now?
Yeah. Yeah.
Yes, ma'am.
Yeah.
All right.
Yeah. I'll
Finally,
just
I get to
request.
speak now.
Yeah.
Thank you. Yeah.
Yeah.
Sorry,
Yeah.
doctor, you were saying?
Yeah. I'm just requesting you because it is already 4:30 p.m. Right?
Yes, I
So
know.
our time
Yeah,
is good.
I'll try to omit a lot of things.
Yes.
Yeah.
Yes.
So
I
let's not
understand.
waste time.
Yes. 10 to
Yeah,
15
let's
minutes,
not waste
and
time. Can
because there
I?
are so many question answers also afterwards.
Yeah. Can I
Thank
into
you.
my session, please?
Thank you.
Yeah.
Thank you. Yeah.
All right. Thank you. First of all, I would say good evening, namaskar, and I'm very honored to be part of this mental health session. And thank you very much for the opportunity to allow me to share my journey. I am learning Hindi, so let me also address this a little bit in Hindi for those who don't speak English well. Namaskar, मैं इस मानसिक स्वास्थ्य का हिस्सा बन पर बहुत गौरवित महसूस कर रहे हूँ and मुझे अपने यात्रा साझा करने अवसर देने के लिए सबको बहुत बहुत धन्यवाद. All right, so let me begin with I was actually going to focus on my personal journey on mental depression, mansik avasad, mental illness, mansik birman, sexual abuse, Yon Vishan, and child abuse, Bal Shushan, and of course, suicide, self-harm, and self-abuse, which is Kutkushi. But because of time strain, I am only going to focus on my recent current situation due to the COVID. So I am abusing myself, and I have attempted suicide several years ago, but not now. And I'll also talk a little bit about mental depression and the treatment I'm receiving at the moment, okay? So first of all, I'm very thankful for this lockdown because COVID-19 has first helped me find myself, find me. My day begins and ends with gratitude and joy. I'm in charge of how I feel. And today I'm choosing happiness. I am free, I am peaceful, and I'm filled with love. So I choose to empower myself and celebrate my life, right? So now let me get to the more negative part. That's the positive part. Okay, this topic is truly interesting: depression, loneliness, and the dark corridors of life. The dark corridors of life, they actually hide many demons. How does it feel to have nothing, no hope, no light, no love? There's a quote by Mehmet Murad Idan: a man who can be happy with the crumbs of light in darkness and the dark corridors of life definitely deserves brightness in the sun. All right. Now, depression, loneliness, suicide is indeed a popular topic. And we know that people all around the world go through this. Yeah. Some seek help, some are in denial. I personally myself have attempted suicide 3 times. Right? Did you know that loneliness and depression, it's slowly becoming an epidemic? Loneliness leads to depression, all right? And from the depression, it leads to stress, anxiety, and it can cause a range of mental illness. Trust me, I've been there, I still am, but I'm lucky to get help and found ways to help me and heal me, which I will share soon. I choose living alone, away from extended family, because why? It's less stressful for me. depression is indeed a cruel punishment. There are no fevers, there's no rashes, and it's just a slow erosion of life. It's like cancer, and it's essentially a solitary experience, because I also suffer from early stage cancer, right? I don't think people understand how stressful it is to explain what is going on in my head. I have lots of thoughts in my head, and to explain it to people, I think I'll need them to sit beside me the whole day to explain what is it I go through. And half of them are ignorant because they just choose not to learn and understand what mental depression or illness is about. All right. So, and for many, I understand part of them would want to die tonight. Part of them would wish I died in my accident, so I don't have to go through this pain that I have to endure daily, But I thank my mom. She's passed on now. My mom was a spiritualist, so she taught me meditation. And meditation has made me the person I am today. I'm happy, I'm free, I'm peaceful. Why? Because I practice gratitude meditation. I practice empowering myself, and I go within myself to find myself, and it has helped me tremendously. So I will now quickly move on to my accident. Okay, just a quick brief summary about my accident. Now, my accident happened in 2007, trusted a dear friend, and that friend drugged me with the intention of rape, all right, and left my skull damaged. I almost went blind and brain damage. I went through 16 surgical procedures. And during that time, I also went through coma. And during that coma, I experienced the other side of the world, the outer world. And when I came back, I decided to change my name. And that's why my name is Tia and not Satya, because I feel Satya died in the accident and Tia was born. So my psychiatric treatment started in 2009. I was going to talk about my sexual abuse. I was going to talk about a few other things, but because of time, I'm going to cut all this. Maybe we'll do it another time if time permits. But today I'm going to go straight into my psychiatric condition and the help I'm receiving and the process that I'm going through. And a lot of what I am currently being treated was earlier on explained by the other psychologists and doctors that spoke much earlier. So I'll highlight a little bit about what I'm going through now. Psychiatric treatment started in 2009 to present, and over the years, I have changed many doctors, but there have been 3 amazing doctors in my life: Dr. Morgan, Dr. Fabian, and my current doctor, Dr. Cheng. Now, my current treatment is pretty amazing because this is one doctor who has listened to my needs. And it's so important to get a doctor who takes time to listen to you, because many doctors don't actually listen. They just go by the book and they treat you as per what they need to treat you with. Right. Now, my current treatment involves psychodynamics. Now, for those of you who may not know what psychodynamics and psychoanalytic therapy is, the aim of psychodynamic therapy is to bring the unconscious mind into consciousness, helping individuals like myself to unravel, experience, and understand my true deep-rooted feeling in order to resolve my issues. I'm also going through social rhythmic therapy, or social rhythm therapy, also known as IPSRT. Interpersonal social rhythm is an evidence-based treatment designed to help people with bipolar disorder improve their mood by understanding and stabilizing biological and social rhythm, essential elements. Social rhythm therapy to regulate daily routines and emphasis linked to mood. Interpersonal therapy to emphasize link between mood and life events. Education to support habits and routines relative to medication. Goals: create and sustain consistent daily routines, sleep and wake cycle. Increase skills to reduce the number and severity of socially based stresses. Learn skill habits and routines to prevent future effective episodes. In my case, I abuse my feet. I've actually got a picture to show, which I'll show after I finish talking, all right? And all right. And these 4 stages of treatment are basically the initial phase that focuses on my past history, talking about links the disruption in routines to effective episodes and establish the steps for my treatment. 2, the intermediate phase, which is focused on recognizing social rhythms. 3, the maintenance phase, focusing on reinforcing new social rhythms and building confidence in techniques learned earlier in treatment. And the final phase is reduction of frequency of visits to work towards termination. The outcome of my therapy hopefully will improve the occupational functioning of my mood stabilization and my social rhythm stabilization. The next treatment that I'm also doing is called distraction techniques. Now, this distraction techniques here applies to my feet abuse. What are distraction techniques? Distraction techniques is a form of coping skill taught during cognitive behavioral therapy. These techniques are used to distract and draw attention away from auditory symptoms of schizophrenia, such as auditory hallucinations, voice hearing, intrusive thoughts, which I go through very often. This is where art is my therapist. As you can see behind me, I am an artist. So art has become my healer and my therapy. I dance and paint, and I also sleepwalk and paint because I suffer from insomnia and I don't sleep. The most sleep I get in a week is maybe 15 to 25 hours a week. Yeah. So I also dance and paint. And I term myself the mixed media healing energy story artist. Each painting has a story, and I hope that my painting and its story will help people with similar situation or symptom, help them with their journey. My next session, which the doctor is going to tackle on, would be interpersonal therapy. All right. Now, the interpersonal therapy is where we address the issues I have with my daughter. My stress level or my depression during this pandemic crisis is actually from the way my daughter bonds with me. It's been a year now since I've heard from her. She's practically removed me from WhatsApp, Facebook, everywhere else. Not once she's asked me like, "Mommy, how you doing? Are you all right?" Because she's also going through her own trauma. Because my daughter and I, we were separated after my accident when my ex-husband divorced me after he saw pictures of what my face looked like. I was totally damaged, my skull, my face. So when he did come to Malaysia, when the doctor removed all my bandage, the first question he asked me was, "Is this what you look like now?" Like, wow, good luck finding a man with this face. And that year later, he separated my daughter and me. And my psychiatric treatment started in 2010 because in 2009, when my ex-husband told me I would never see my daughter again and I will never have her in my life, my mom kind of supported what he said, and she was supporting everyone else except me. I just saw a knife on the table and I actually took the knife to stab her. And that's when my mom realized something was terribly wrong with me and I needed help. And that's how my psychiatric treatment started in 2009. So what the doctor does with me now, the interpersonal psychotherapy skills will be done in my next visit. That will be my next session with him. But with my psychodynamic and rhythm therapy, I've been asked to fill up how many times a day I have the urge to peel my feet, how many times a day I want to scratch or have the tendency, because it's become my self-coping mechanism. It makes me feel good. I'm addicted to peeling my feet. And why my feet? Because my face is pretty. I don't want to destroy my face. I don't want to destroy my body. Yeah. So my feet, I can cover it with the socks. I can cover it with a shoe. So it's my target. So what I do when I'm watching any movies where it has a mother and daughter connection, I start missing my daughter. So what happens here is I start unconditionally peeling my feet because I don't realize I'm doing it. And when I do realize I'm doing it, the bleeding has already started. And there are times when I can't get up and walk because my feet just hurts so bad. Yeah. So sadly, my depression and current abuse and harm episodes are triggered because of my daughter, as I said. Okay, I see friends and their daughters, and they have such wonderful bond. Then I start to miss and ask myself, why is that happening to me? Why don't I have this? Um, why don't I have this relationship with my daughter? So, and what happens is whenever I have my shower, yeah, my feet becomes very soft. And when my feet is soft, what happens? It's so much more easier to peel that layer from my skin, right? Now, I keep on doing it, and there are times I can go on doing it for 2 or 3 hours. Why? It's COVID. I got nothing to do. I'm watching a movie. There's children involved, and I psychologically attack my feet. Yeah, and later on, I have this guilt and this ashamedness, like, no, I've done it again. And I would then pamper my feet with turmeric, with aloe vera, with coconut oil, with something called the tree factor, which I'm using on my skin, and it has helped me a lot. But this treatment is all expensive, because I do it now, I heal myself, and then tomorrow I'm going to do it all over again. And then I take a step back and I'm like, why even bother? Because I'm just going to constantly abuse myself, right? So I was asked to create a chart analysis, and this new treatment of how many times and why and when I do it is requested by my current psychiatrist who's treating me. And the toughest request from my doctor was to choose one day of the week and don't peel at all. Now, this is going to be very challenging for me because it's really difficult to do that. All right, so I think my time is also up. So I'm quickly going to end and say, Dr. Abraham Hicks says, the reason you want every single thing that you want is because you think and you will feel really good when you get there. But if you don't feel really good on the way to get there, then you can never get there, because you have to first be satisfied with what is while you're reaching that. Okay, friends, we must forget what we think. We need to focus on feeling good. Feeling good will bring us far more than what we thought we needed. Happiness needs to be the outcome that we desire most. Confidence is not something you're born with, it's built over time. And how many of you agree to disagree? Yeah? Because from the positive, the negative experiences in our life, the powerful result of being that hard-won confidence also is sometimes hard to destroy, because the popularity of winning is not putting others down, but sometimes you need to praise yourself. You need to feel good about yourself, right? You don't need words of praise or support from others to feel it, because only you can do it. Only you can stop what you do. Only you can bring that empowerment to yourself. And I think the best part about finding and harnessing this power within myself is that it gives me the confidence and the strength of self-worth. I do not give anyone permission to hurt me. Hence, I bubble myself up because I want to keep myself safe. I don't want to be abused. I don't want to be bullied. I don't want to be discriminated. I don't want to be, abused in any way, because I believe in myself. I love myself. So why should I let anyone hurt me, right? So I may live in solitude, in a very solitude world, and I've been doing that for 11 years now. But in this loneliness, I find joy. So when the COVID came about, I didn't really feel the lockdown. You know why? Because for the past 11 years, I've been living this life of solitude. I'm used to it. But this COVID gave me ways for me to discover myself, to get creative, to learn about things I like doing, things I want to learn to do. So mental illness is not understood by many. Creating awareness like this today and educating is so essential because, as I said earlier, so many are ignorant. I truly thank you for this platform because this platform and helping me share my personal journey. Of course, I couldn't share a lot more, but I hope whatever I've shared is just not gone through by me, but I'm sure many people are going through it. And I hope they find the right help, the right doctor to treat them correctly so that they can come out of that depression and find that empowering life. And, and I believe in this quote, today's impossible dream is tomorrow's reachable star. So thank you so much again for this opportunity to speak, and namaste.
Thank you, Tia, for this very emotional journey, what you shared, and it's a heart wrenching for all of us. Just by going through, just listening to your story, I think we all were became so much emotional and could correlate what the ordeals, what you have faced over a period of decade or even more. And but we must,
Doctor,
we
sorry,
must,
doctor, can I just add one more thing, please?
yeah, yes,
Next year,
please.
I will be coming to India next year because I've decided to go on this not just spiritual journey, but also this empowering journey where I'm going to be doing a lot of volunteer work and teaching art to tribal children, the slum children, and maybe set up exhibitions and so on. So I'm really looking forward to this journey. So thank you so much again.
You are most welcome to our country. You will be our guest.
Thank you.
There's no doubt, and all over India, you will be treated like anything. That's we can promise you, because we really want to share with you, because we have got so many incidences in India also. Just I can correlate with that the brave girl, brave lady Lakshmi. Again, she also
Yeah, I
went
saw
on
the
the same
picture.
ordeals. Yes, it was a case of acid
It was
attack and all
inspiring.
those things, and so much ordeals. So when I was listening to your story, and incidentally, Dr. Naupri Kaur is sitting there, who is a very good personal friend of Lakshmi, and she is the founder of that Lakshmi Foundation also. So
I actually want to meet
we will
her.
definitely be in touch with you,
Thank
and we
you.
can see, yeah, if we can go ahead further. And as I can pick up, you told earlier that previously your name was Satya Bhama. Am I correct?
Yes,
Satya.
correct.
So I think Satya, if you translate, Satya is a Hindi word. If you
Truth.
translate it, it means true or fact.
Yes.
So I think you are absolutely true to your name. So rather I would
Thank you,
say,
doctor.
I would say you don't change your name, because your name Satya, that gives an entirely different kind of, you can say, whole this meaning to your name,
You're very
because
true. Yes.
you can correlate exactly with your name. So of course the choice is yours, but I will request you to just revert to your original name, because that's what give you the strength as well. And unfortunately, because the time is very short and we have been bombarded with so many questions in the chat box, I was just noting down what could I pick up, because in 10 minutes we
Dr.
have to
Adarsh,
finish.
sorry for
Yes,
interrupting
yes,
you.
please.
I have a
I'll,
question for Satya.
yeah, please.
Actually, firstly, I want to just add on that all the speakers has really discussed about the, psychological resiliency, the ability to mentally or emotionally cope up with this crisis. If we focus on Tya's story, surely it is, I feel it is now our responsibility to ensure that the people around us should not feel the depression. We should not make them feel lonely or make them feel depressed. I have just received a message from some person. If Satya can answer, one of my known to person said, I have faced depression due to ignorance. And then I made myself a very busy person to avoid ignorance by others. Is it a wise step? Although it does not give me any kind of satisfaction.
Okay. Many people, as I said, are very ignorant towards mental illness and depression. Yeah, they don't really understand what we go through because we live in a very solitude life. in a solitude world. All right. And I'm confident that all this pain will vanish. Someday it will be invisible. And when it is invisible, it will take a lot of boldness and also to put yourself forward. And you can only begin by doing this by loving yourself first, because you can't expect everybody to love you. You need to love yourself first. When you love yourself and you feel your self-worth and you're confident, I can do anything anybody else is doing. I'm not subject to, I cannot do this, you cannot do this. I'm not a subject of bully, because when you let people control you, that's when you cannot move forward. That's when you sink deeper into that depression. But when you say, you know what, heck to what they think, I am me and I can do this. If I want to climb Mount Everest, I'll do it. You know, so you need to find that courage within yourself. You need to start by empowering yourself. Find that love in your soul, because we all deserve to love ourselves first. Because if you cannot love yourself, you cannot love anybody else. You need to start with yourself. Find that happiness within you first.
Thank you, Thea. And I request Dr. Zorati to please add on some positive words on this statement. And as I would like to add on a case that if a failure or rejection in love, as in case of Jia Khan, an Indian actress who committed suicide, she was not happy in her love life. In her suicide note, she has written, "I have no reason to breathe anymore. All I wanted was love." If Dr. Zorati.
Hello, hi, I'm here.
Yeah.
Okay, thank you so much for the question. Okay, I have a very simple quote here. Okay, all of us want to have, want to be positive, like reduce unhealthy thoughts and behavior. Am I right? So why not try building happiness as well? Actually, happiness is in our hand. We cannot rely on anyone else. I have met some people who rely too much on other people, say it husband, maybe family members, where it lead to the social isolation at the end of the day. Is lead to the rejection at the end of the day. So the person should create their own happiness, like the 5 tips that I gave initially during my session. Okay, like PERMA, like positive emotions, everything can be created by our own. Okay, love is another important thing in our life. Frankly speaking, everybody will look for the love, but not everyone will get the pure love. It is difficult, but as what Ms. Tia said, we should love our own self before we expect other people to love us. Be positive, surely we can find the love, we can find the happiness in ourselves.
Okay. Thank you so
Dr. Adarsh, if you want to ask any question, or if you permit me, I would like to ask question to
Dr. Nopreet Kaur, are you able to listen me?
Your voice is not clear.
Voice is not clear.
Yes, now it is clear. You can.
Now it is clear. Okay, then now we came at the next stage, and now it is a session of interaction, and there are several questions put by our viewers, participants. What on the deliberations on the topics covered by our panelists, particularly Dr. Zaili Wahab, Dr. Adarsh Kohli, Dr. Hidwa Abdullah, Dr. Hima Priya Jaipal, Dr. Zuriyati, Dr. Asha Srivastav, Dr. Soumya Kumar, and Mr. Aksari Hussain Shakti, and last but not least, very excellent speaker who told her own story. As you know, in anthropology, we used to study other cultures, other peoples, other populations, other places. But we used to avoid ourselves. When we study ourselves, then there are several kind of biasness, and we are not able to minimize that kind of thing, that kind of element. But the way Miss Tia, Dr. Satyabama, narrated her own case is no doubt and outstanding, outstanding.
Thank you so much.
So there are several viewers uh, seeing the comments and getting the views of them, as well as participants who are directly interacting with this place, Alpha Forensic Lab. So they all are requesting to Miss Satyabhama. Satyabhama, please go ahead and narrate your story in a book. You
I have
come,
actually, Doctor, I've actually written a book, but I don't
you
have the
come,
funds to publish my
you
book.
come on and come up with a book.
I have written 2 books,
And we are eager
but I'm
to,
not.
yes, look at on that particular contribution and your discourse and delivery. So our panelists, as I've also already told you, that this interaction session named as webinar, international webilogue, yeah, international webilogue on depression and loneliness. Our panelists excellently covered the aspects like what exactly the concept is of depression and loneliness. First of all, we have to understand the concept of depression and loneliness, because we are also an academician. We are academics as well as clinician also. So first of all, our panelists
So I have noted few questions from the audience. The specific questions, these are open for all the speakers.
concept of, and then on the types of depression and loneliness. And then they all covered the feed like influencing factors. Influencing factors. Dr. Susaili Wahab covered this particular field holistically in anthropology as well as in forensic psychology or anthropological psychology. We used to talk of holistic approach, holistic approach, holistic approach, which was asserted, addressed by Professor Bronislaw Malinowski when he did excellent work on the Argonauts of Western Pacific, a very excellent book came up. So influencing factors were dealt with, like excellently dealt with Dr. Susaili Wahab and Dr. Adarsh Kohli and Dr. Hilwa Abdullah. They covered the particular topics related with the concepts, types, influencing factors. And few of our panelists like Hema Priya Jayapal, Dr. Zuriati, Dr. Asha Srivastav gave their their deliberations on the statistics as well as on the treatments. I'm not telling that Dr. Suzaili Wahab and Dr. Adarsh Kohli and Dr. Helwa Abdullah has not given their counseling session to us. They also covered this particular topic, but the way Mr. Aksari Hussain Sakti, he told or narrated or attempted to enlighten us about the cases of about the legal cases, like cases related with the Supreme Court, legal aspects, constitution. So, Dr. Aksari, I'm really thankful to you. We all are really thankful to you. You spoke so well. Dr. Soumya Kumari and our all, each and every panelist did their excellent effort, outstanding and wonderful efforts on this particular international Webilogue, but no interactive session, nothing is complete. If I ignore, if we ignore the ideas, the views, and the questions raised by our participants, viewers. Our viewers were on the Facebook, YouTube, and Zoom. I found that over 100 and over 100 and more than 100 questions were forwarded to me. But due to the time constraints, I'm not able to take up each and every questions raised or forwarded to us because I will fail my duty if I would not cover or put the questions on behalf of our viewers to our panelists to give their ideas, give their own views on these particular questions. So my first question is, I'm just reading, it's happened whenever we broke up with the relation, we come up to depression. Thinking that we have done everything, whether we done it or not, and blaming ourselves for the relation. So how we can overcome the wrong thinking about ourselves? This question goes to Dr. Adarsh Kohli. If you are here, then please come up and give your ideas so our this particular participant.
So the question was that if we have a broken relationship, you tend to blame yourself and to end up in depression.
So how we can overcome this wrong thinking about ourselves?
So what happens is that and what we need to change our thinking in that case, because the relationship did not break because of you. It might be, it broke because of other reasons. And in that case, I think you have to think about the other person, that maybe it was not worth it at all. Maybe he was not the right person for me. And maybe whatever God does is for the good. So one has to accept and not put the blame on ourselves. Because if you try to put the blame on self, then the other person is the winner, So you have to say that it is good for me after all. And then you see all the negative things in that, and you say that, there were moments when I was not happy. There were moments when we were fighting, and there were moments when, there was some incident. So you keep thinking of all those things and say that it was no good after all, and that's why we broke. So it's you don't have to self blame. You have to accept the thing and make yourself capable of accepting it and then redirecting your life. Thank you.
Okay. Thank you, Professor Adarsh Kohli. Now, from Hindi, because this particular participant is of Hindi world, so Dr. Asha Srivastav, if you are able to hear me, listen me, please आप हिंदी में यदि कुछ इसका उत्तर इसको दे दें तो ये ज़्यादा संतुष्ट हो जाएगा।
इसी सवाल का
डॉक्टर
क्वेश्चन।
आशा।
यस 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 यार मैं बोल रहा हूँ। जैसा कि मैडम ने बताया, बहुत अच्छा पॉइंट इन्होंने बताया है कि फर्स्ट अपने को ब्लेम करना छोड़ दो। ब्रोकअप हो गया है तो मे भी अच्छे रीजन के लिए हुआ होगा, नंबर 1। सेकेंडली जो मेरा है, अगर आप इट्स अ माइल्ड ब्रोकअप हुआ है, माइल्ड थिंकिंग अगर आ रही है तो आफ्टर 6 मंथ अपने आप में नॉर्मल हो जाएगा। सो आफ्टर 6 मंथ जो आपका रूटीन आ जाएगा, आप अपना गोल बनाना शुरू करो। मेरा लाइफ का गोल क्या था, मुझे आगे अचीव क्या करना है। सो दैट इज द मेन थिंग। आप अपने को ब्लेम करना छोड़ दें कि मेरी वजह से हुआ, मे भी आपके अच्छे कारण से हुआ हो, आपको इससे अच्छा बेटर मिल सकता हो लाइफ में, रीजन हो सकता है। तो अगर आप ब्लेमिंग करना छोड़ देंगे, यू थॉट योर अपना जो नेगेटिव थॉट को ट्रांसफर कर दो अल्टरनेट एक्सप्लेनेशन के ऊपर। ये जो हुआ अच्छे के लिए हुआ, वो मेरे लिए ठीक नहीं था, मुझे इससे बेटर मिल सकता था। तो आपका ये ब्लेमिंग, जो ब्लेम अपने आप को कर रहे हो, तो वो आप अपने को आपकी गिल्ट फीलिंग भी खत्म होगी और ब्लेमिंग करना।
Very good, very good. Now the next question is related with the statistics. What is the percentage of suicidal death due to depression in India? So I think that it can be covered, it can be taken by the Alpha Lab also, and Alpha Lab has given the statistics that every hours one student commits suicide in India, with about 28 such suicides reported every day, according to data compiled by NCRB, National Crime Records Bureau. So, the NCRB data shows that 10,159 students died by suicide in 2018, an increase from 2017 and 2016. Okay, I hope that these viewers are listening me and agreed also. And if anybody is willing to comment on, then he or she is welcome from the panelist view. If not, then it's all right, and I'm going to take up the next question, that is whether we can come out of loneliness by practicing yoga. Yes, Dr. Suzali Wahab, she presented the treatment, how the treatment should be given to the depressed person. Very excellently she spoke. There is holistic medicine. So I'm willing to have her views on this particular question. Dr. Suzali Wahab, are you able to listen me?
Yeah, hello.
Yes.
I will have to answer the question a bit.
Thank you so much. Your library is excellent.
So,
Excellent. Wonderful library. We all has a wish to visit there.
Sure. Welcome to Malaysia. Okay, so as I mentioned earlier,
yes, madam. Please.
The modes of treatment, there's a number of treatment that can be given. So basically, there's a role of medication or pharmacological treatment, and there's also a role of non-pharmacological treatment. And one of the ways of achieving or reducing stress, which may lead to depression, is by doing exercises or yoga, as had been mentioned. But I would rather be a bit cautious if we want to associate yoga with the remission of depression, because practicing yoga is actually one of the ways to help relax or calm the mind. But if it is not the only way that depression can be treated, so it is still very important to have a really good view of the severity of depression. So in cases of mild depression, sometimes we can go with the non-pharmacological intervention, as has been mentioned by other colleagues here, such as yoga or practicing other behavioral modes of intervention. But in cases of severe depression, usually there are a number of factors that we have to consider. The person may be having not motivated, having symptoms like anhedonia or very depressed, whereby they do not really practice yoga. So in a way, it is helpful, but it is not the only answer for eliminating or having remission from depressive symptoms. Is that answering the question?
Okay, thank you. Thank you so much, Dr. Suzali. Now, from Indian panelist, यदि आप हिंदी को भी थोड़ा सा वो कर लें तो हमारे व्यूअर्स और बेनिफिटेड हो जाएंगे प्लीज, यदि इसमें कोई हो। डॉक्टर आदर्श कोहली।
हाँ जी, हाँ जी।
हाँ हाँ, क्या आप हमारे व्यूअर्स को लाभान्वित करा सकती हैं अपने
योगा का क्वेश्चन
हाँ,
कर रहे थे
योगा।
ना ये? तो योगा जो है,
लोनलीनेस,
अगर तो माइल्ड डिप्रेशन है और आपको जो है फीलिंग्स ऑफ लोनलीनेस आती हैं, तो योगा मेंटल और फिजिकल बहुत हेल्प करता है, मेडिकल और मेंटल और फिजिकल हेल्थ के लिए। लेकिन सिर्फ योगा कहना, जैसे इन्होंने भी कहा, योगा पे टोटली डिपेंड करना ठीक बात नहीं है। अगर मॉडरेट डिप्रेशन है या ज्यादा है, उसमें फार्माकोलॉजिकल दवाइयाँ और साथ में योगा या जो साइकोलॉजिकल टेक्निक्स है वो यूज करिए, तो वो सबसे बेहतर रहेगा। और डॉक्टर की एडवाइस जरूर लीजिए। अगर डिप्रेशन लास्टिंग है, ज्यादा है, उसमें सिम्टम्स आ रहे हैं, तो सिर्फ योगा काम नहीं करेगा। वो आपको मेंटली हेल्दी बनाता है, लेकिन वो माइनर और मिनिमल डिप्रेशन और माइनर डिप्रेशन में काम आता है। ज्यादा हो डिप्रेशन तो काम नहीं आता है। फिर उसको कॉम्बिनेशन करना पड़ता है दवाइयों का और दूसरे मेथड्स का, मेडिटेशन हो, योगा हो, आर्ट ऑफ लिविंग हो, डीप ब्रीदिंग हो, ये सब चीजें बहुत काम आती है, नॉर्मली भी और माइल्ड डिप्रेशन में भी।
Okay, thank you so much, madam. Now this question goes to Dr. Hema Priya Jayapal, related with the anxiety. It has been asked that anxiety can be very debilitating as your brain is simply unable to process with clarity, thus impacting your simple daily task. It will be great if someone can explain what happens exactly in the brain for anxiety to occur. Dr. Hema Priya Jayapal. Hema Priya Jayapal?
Yes.
Yes. Please, give your comments.
Yes. Regarding the anxiety, if you see, it comes only when the adrenaline pumps a lot in our body. So actually, if you see the subtleness in that time, we have to ensure that let us not discuss about that topic in that time. For example, if we are in a traumatical situation or if we are excited too much, we will not be able to handle that situation in a proper way. During that time, we have to give a pause for it. And then after some time, we have to think about it. And if we are not in a situation to say anything about it, let us give a neutral answer for it. Instead of giving a direct hitting answer, we can give a neutral answer so that it will not harm the other people. Out of anxiety, if you see, most of them, they tend to do wrong things because our brain will not work in a proper way what our mind says. So obviously we will not be in a situation to do whatever that we think. So what we have to do, we have to give a pause for that time, and then after some time we have to ensure that we actually do the right thing.
Okay, thank you so much. Now, Dr. Nopreet Kaur, are you having some questions from the viewer side?
Yes, sir. I have a
Yes,
question.
yes, you. Then you go ahead with those
Dr.
questions.
Kohli, as Dr. Kohli, can you listen me?
Yes,
Yes,
yes, everybody is listening you.
Uh, okay, so as Dr. Kohli discussed about the writing, that if you can write about your emotions, then you can somehow come out of depression and loneliness. I would like to discuss about the cases of Dr. Anurag Kumar, the resident of Ames, who recently committed suicide, and a case, I will not say the case of suicide, because as a legal person I cannot comment that this is case of suicide of Sushant Singh Rajput, as case has not been closed yet. He was found dead at his home. In both the cases, if we see, Sushant Singh Rajput has written 5 diaries. The police has found 5 written diaries by Sushant Singh Rajput, and Dr. Anurag Kumar has written a full blog about his psychological problem. So what is the importance of writing? If some person is already writing something, and still he has committed something, committed suicide or some that kind of action. And one more question related to this, as we can see from the blog of Dr. Anurag Kumar, that he was discharged from the hospital. So in this case, are the patients with the depression at heightened risk of suicide as they begin to recover? Because because I have read few research papers where it was written that there is some kind of theory that risk of suicide increases just after their depression seems to be improving. Is there any kind of theory that it is giving some in more energy when he was already discharged? He was a psychiatric, he was a doctor, and after his discharge, when he rejoined his job, then he committed suicide. So what is the importance of writing, and is there any risk of suicide, that energy has been increased and he commits suicide? Is there any relation between such cases?
I I don't find Dr. Adarsh Kohli here on the screen, probably because it's 5:20 p.m. Probably she must be busy. Yeah, I think probably she has left.
I
Maybe
request if
some other speaker, if she can share the views on this, she is most welcome to share. Anyone?
Dr.
Okay,
Zuri Yati
Yeah.
can share her views, I hope.
What
hi.
was the question again? Sorry.
Yes, yes. Thank you, Dr. Sujali.
Hi. Perhaps can I possibly give some of my opinion there? So I think what Dr. Navpreet has mentioned is basically quite often seen in the patients that I've managed to, especially if the patient is having high, very intelligent, very innovative. So when they have depression, because of the depression, that's correct. They don't have the capacity to think actively of what they are going to do next. For example, if they are suicidal or if they have certain plans, usually it also comes with a depressive episode. So they are not like having the full insight of what is going on. So I guess in the case of this doctor, probably one of the possible reason is that there are other triggering factors outside of the hospital, whereby we must also look into the precipitating factors. Maybe it's the family factors, maybe it's the other factors that can also increase the suicidal thoughts again when the patient has been discharged. But the one question is that if we are treating depressive patients with depressive symptoms, we must also have a higher tendency to be more watchful for those who are of highly intelligent people, and especially and also resourceful. Doctors, they are also linked to have the more little means because of the drugs or medication that they have, you know, the easy accessibility. So I guess that may be one of the possible factors.
Thank you so much, Doctor.
Okay, so there is one question from the one of the participants that I would like to put to Ms. Tia alias Satya.
Yes.
Suicidal thoughts are instant, or does it take a period of time to develop?
For me, it didn't take time to develop. When something happens and I could not cope with it, like when my daughter was separated from me, for me, it was like that's the end of my world. And because I didn't have the right support or anyone to give me a hug and say, stop, this is not the right way, we can work something out. I was all alone because my life was in that solitude state. For me, the easiest part was take my strongest drugs, which was Lexapro and Respirodon, which are my psychiatric drugs. I take them and boom, I'm gone. You know, so end of the world, I don't trouble anybody and life is over. Everyone's happy, including me, because I've taken the easier route out. But then I realized that's not the way to do it because there is support out there. I just need to seek it. So again, it depends on the individual, their mindset. Their mindset is actually very important.
That's great. Then there are few questions what I could pick up from the chat box. They are specifically pertaining to some kind of medication and all. So maybe Dr. Yati or Suzali may be the better person to comment upon this. There are three questions back to back on the same aspect. If someone was diagnosed with the depression or MDD, that is, I can understand is the manic depressive disorder, is it okay to continue life without medication? That's one question. How to recognize someone who was diagnosed with MDD fully recovered? Again, the same part of that question. And if someone has depression, but he or she has led a busy life to prevent the melancholy moment alone, will the depression vanish? So all these three questions are the part of the same questions apart. So maybe Dr. Suzali, and I will request Dr. Yati and other speakers also to comment upon this.
Maybe I can start regarding the treatment. So the first question is if the depression has achieved full remission, whether it is possible to be off medication. Am I correct? Without medication. So yes, I've seen cases in which patient has been diagnosed as having major depressive disorder for years, but over the years, as they become elderly or more age, then therefore the symptoms achieve full remission. So in this case, we will taper the medication down and then try to off the medication. If let's say the patient is stable, yes, the patient can be off medication, and sometimes they just have to come and visit the psychiatrist just for us to continue observing whether they have the symptoms or not. But patients, yes, they have been off medication for years. And then the second question is regarding the is it assessment? Can you repeat the question for the second one? Is about
Second was how to recognize someone who was diagnosed with MDD fully recovered.
okay. So the work is actually falls on the responsibility of the psychiatrist observing the patient, because that's why there is a need for continuous follow-up. So usually we will give a 3 to 6 monthly follow-up for patients just for us to observe the symptoms. All the symptoms that I mentioned earlier, which basically persistent low mood or persistent poor sleep, persistent loss of appetite or loss of weight. So those are the telltale signs that the depression is still not improving. So therefore, we need to be a bit of caution if we want to stop or reduce treatment. And it is advisable that the medication is continued. And the last question is about keeping busy, is it? Keeping busy
Yes, yes. If someone has depression, but he led a busy life, to prevent the melancholy moment alone, will the depression vanish?
Yes. Okay. So I have come into experiences that even severely depressed, patients having severe depression, they come to me asking that, doctor, if let's say I'm engaged more socially or engaged in the community, will it heal my depression? So I'm seeing that the depression core symptoms, one of it is the pessimistic outlook towards life. So therefore, by keeping busy, yes, some people may be able to distract their thoughts temporarily only from the depressive thoughts. But when they are not with other people, or when they are off this interaction, then the depression will start creeping back in. So I guess if you are looking for temporary solution with the low mood, possibly it will help. But what I can say is that even some patients complain that by doing so, they tend to feel very tired. It takes a lot of energy from them to make or to mix up with other people. So therefore, it doesn't really solve the problem. And I think the depression of that kind needs to be more treated more aggressively rather than by changing the daily life patterns.
Also, a question related with this, that whether hormonal changes can be a reason for a person to go in depression. Dr. Sujali Wahab, please give your comments
Sorry, Prof, is
on
it
it.
the
Hormonal changes, yeah.
hormonal
Can
changes?
be a reason for a person to go in depression.
Yes. Of course, when we talk about mood symptoms, basically it is also linked to hormones, and it is not surprising that there are many women experiences low mood, which is in relation to their monthly cycle. Okay, so basically every history is very useful to us, whether the symptoms become worse during each menses, or maybe if they have other hormonal factors like having ovarian problem, maybe ovarian cancer or ovarian cyst. Sometimes the hormonal triggers can actually increase the mood symptoms. So it's like ruling out all these medical problem or medical issues is the key here. So after ruling out all these, then we can say the patient has only psychiatric reasons of depression.
Okay, thank you so much. There is a philosophical question now. Philosophical question. But this question goes to Dr. Hilwa Abdullah.
No.
She's not here. Then Dr. Zoriati. She's here. Okay, when I ask, loneliness will lead to depression, or depression will lead to loneliness, or vice versa. Very interesting and very philosophical question. What comes first? Loneliness will lead to depression, or depression will lead to loneliness. Yes, yes. If who is available? Eh?
Is Dr. Ashima there on the?
No, Doctor Asha Srivastava. हाँ, yes, yes. डॉक्टर आशा श्रीवास्तव, ये क्वेश्चन आपसे है. ये क्वेश्चन बड़ा फिलोसॉफिकल क्वेश्चन है, बड़ा फनी है, इंटरेस्टिंग है कि लोनलीनेस विल लीड टू डिप्रेशन और डिप्रेशन विल लीड टू लोनलीनेस और वाइस वर्सा. क्या है इसमें सत्य क्या है? ये तो इट कैन बी आल्सो पिक्ड up by Satyabhama. But now
Yes.
this question goes to you, Dr. Asha Srivastava. Are you able to listen me?
Is
Please.
it for me?
हाँ मैडम, सुना आपने?
Oh, me. What?
कि हाँ,
Does
loneliness, depression.
loneliness leads to depression or depression leads to loneliness?
What?
Well, I would say it can work both ways. It again depends on the situation you're in. For me, loneliness leads to depression because if depression leads to loneliness, I have lots of good friends. I can always lean on them. But my case is more because I live a solitary life. So I'm already in that very solitude life. So for me, it's more that the depression leads to my loneliness. All right. And but if I were to answer your question, for most people, it would be depression leading to loneliness because they may not have some kind of support. But in my case, if I was answering that question, I would say for me, it was loneliness led me to depression because when I'm lonely, I don't know how to cope. But now I have found ways to cope. I do meditation, I do healthy living, I do, exercise. So it's again coping mechanism, how you cope with yourself and how you find things to do to make you happy. So that loneliness and depression can be killed, but you need to have that support system. And I have my support system through an NGO I'm with called Malaysian Invisible Illnesses Association, or what is known as MIA. We are like a peer support group. I'm part committee. Thank you.
Dr. Hem, Dr. Hemapriya Jayapal. One question has been put before us that is related with your areas. That is criminal psychology. And the question is, in India, these days criminals are increasing in number. So they can be a good subject for psychology students to carry out research work. Is it true? Or can they be involved in our research work?
I think she has left.
She had left.
She is not there. Yeah, because it's 5:30, more than 5:30. So now the people have started leaving.
Dr. Asha Srivastava. Asha Srivastava belongs to Lucknow also. Yeah? और आदर्श कुमार जी भी लखनऊ के ही हैं.
Yes, sir.
Yes, Dr. Asha is there. Good.
Yeah.
हाँ, मैडम प्लीज आप करें इस पे.
No, it's a very good thing. Now in criminal psychology, we can study this thing. It's a really very important topic for the researcher, for students, if they want to study, because they can study in this pattern also in societal. You just repeat the question and then I will give the answer exactly. What is the exact question?
In India, these days criminals are increasing in number.
Correct.
So they can be good subject or for psychology students.
It's a very good subject because in India, many students, they are doing the many research on criminal psychology.
Not
and
question, is it?
Yeah.
Not clarification or
No.
observation. So,
because many students, they are doing many research on different topics. Criminal psychology is a vast area. So there are many subtopic and research topics, and many students, they are doing. I am also PhD guide of many students, so they are doing the PhD under me also related to criminal psychology. It's a really very good topic question for the research. Yeah.
Psychologist.
Thank you.
Dr. Jori Yati हैं? Dr. Jori Yati. Dr. Hilwa Abdullah है? हाँ yes, yes. One question is related with the area of Mr. Aksari Hussain Sakti. अक्सरी अस्करी आप हैं? अरे अस्करी जी आप सुन रहे हैं? okay. हाँ प्लीज कम आप अपना वीडियो ऑन करें। इसमें क्वेश्चन है, कैन यू कमेंट ऑन मर्सी किलिंग डिफरेंट फ्रॉम सुसाइड इन कॉन्टेक्स्ट
सुन रहा हूँ आपको।
है आप सुन रहे हैं?
हेलो।
हाँ तो अपना
हाँ जी अब आवाज आ रही है आपकी।
हाँ अस्करी जी
या
हाँ अपना वीडियो ऑन करिए, हम भी आपको देखें, आप बहुत अच्छे लगते हैं हमें।
जरूर 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 करता हूँ। जस्ट मिनट।
अच्छा जस्ट मिनट, तो आप ऐसे बोलिए फिर। हाँ यस प्लीज कमेंट ऑन मर्सी
देख
किलिंग।
रहा हूँ मर्सी किलिंग।
हाँ
मर्सी किलिंग
does yeah mercy killing is different from suicide?
Yeah, mercy killing is totally different from suicide. Yeah, totally different from suicide.
Yeah, हाँ मर्सी किलिंग पे आप अपना व्यू पॉइंट दीजिए।
जी
और
जी
ये
जी जी
हाँ यही का
जी।
आप ही के
देखिए
व्यूअर
मर्सी
है।
किलिंग, हाँ जी कोई बात नहीं। मर्सी किलिंग तो देखिए उसको अलाउ कर देना चाहिए सुप्रीम कोर्ट को, क्योंकि जो आदमी जी नहीं पा रहा है तो उसको मर जाने का ही राइट मिल जाना चाहिए। या तो आप उसको जीने दें या मर जाने दें। लेकिन होता यह है जब सुसाइड के लिए आपको राइट नहीं है कि आप अपनी लाइफ खत्म कर सकें, तो मर्सी किलिंग में भी कोर्ट के ऊपर टोटली डिपेंड रहते हैं हम लोग, पब्लिक टोटली कोर्ट पे डिपेंड रहती है। कोर्ट चाहेगा तभी हम अपने, अदरवाइज नहीं। हाँ
क्वेश्चन जो
जी
है वो है इज मर्सी किलिंग डिफरेंट फ्रॉम सुसाइड? मर्सी किलिंग सुसाइड से डिफरेंट है या सेम है?
दिस इज
और ये आप कॉन्स्टिट्यूशन के परव्यू में, उसके आर्टिकल के परव्यू में वो उसने पूछा।
जी अच्छा। देखिए मर्सी किलिंग जो है वो टोटली कोर्ट के व्यू पे है कि क्या सर्कमस्टांस है, उस पे कोर्ट अलाउ करेगा या रिजेक्ट करेगा हमारी मर्सी किलिंग की पिटीशन। और जो आपका सुसाइडल अटेम्प्ट है, जो सुसाइडल अटेम्प्ट होता है वो तो एक क्राइम की डिफिनीशन से कवर हो रहा है। जो आर्टिकल 21 है वो हमको राइट देता है, राइट टू लिविंग। लेकिन इसके साथ में एक राइट जो मर जाने का राइट है वो हमें आर्टिकल 21 देता है और या नहीं देता है। इस पे बहुत सारे हाई कोर्ट के अलग अलग व्यू हैं। कुछ हाई कोर्ट का ये कहना है कि अगर आपको जीने का अधिकार है तो आपको मरने का भी अधिकार होना चाहिए। लेकिन कुछ हाई कोर्ट का ये मानना है कि जो आपकी लाइफ है वो खाली आपकी नहीं है, सिर्फ वो स्टेट की भी लाइफ है। तो इस वजह से यहाँ पर जो आपकी मर्सी किलिंग की बात है, तो अगर आप मरना चाहते हैं, कोई प्रॉब्लम्स आपको आ गई हैं, तो ऐसी कंडीशन में कोर्ट के व्यू पे डिपेंड करता है। और ये टोटली अलग है। ये सुसाइड तो हम कर सकते हैं, हमारी इच्छा, हमारी खुशी भी हो सकती है, लेकिन मर्सी किलिंग हमारी मजबूरी होती है कि भाई हम ऐसे कंडीशन में नहीं जी पा रहे हैं, प्रॉब्लम है हमको, तो मर्सी किलिंग के लिए। और उसके लिए तो प्रॉपर पिटीशन होती है, अगर सुप्रीम कोर्ट चाहता है तो उसको अलाउ कर सकता है। अदरवाइज मर्सी किलिंग तो मर्सी पे है कोर्ट के। जी सुसाइडल अटेम्प्ट एकदम अलग चीज है। और मैंने जैसे पहले ही बताया कि सुसाइड करना कोई क्राइम नहीं है, क्योंकि सुसाइड करने के बाद कोई पनिशमेंट ही नहीं होता। हाँ अटेम्प्ट टू सुसाइड जो होता है वही सेक्शन 309 में वो पनिशेबल ऑफेंस है, जिसमें कि सिंपल इंप्रिजमेंट 1 ईयर रखा गया है। और जबकि ये आपका सुप्रीम कोर्ट के डिस्क्रिप्शन पे डिपेंड करता है कि आपको मर्सी किलिंग दे या ना दे। तो ये टोटली डिफरेंट है एक दूसरे से, इसको कोरिलेट नहीं किया जा सकता।
ये मर्सी किलिंग जो है ना, ये तो इंटायरली आप हमारे डोमेन में आ गए, आज का टॉपिक नहीं था. मे बी वी कैन इट्स अ होल न्यू टॉपिक, होल डिफरेंट टॉपिक when we talk about the active euthanasia and passive euthanasia, right? डॉक्टर नवप्रीत कौर ने यूथनेजिया के बारे में जो सुप्रीम कोर्ट की रिसेंट गाइडलाइंस हैं, इंडिया में इसकी क्या पोजीशन है, कैसे अलाउ किया गया है, पैसिव यूथनेजिया किसके कंडीशन में अलाउ कर सकते हैं, बहुत सारी गाइडलाइंस और अभी इसके अंदर हैं. So I think there is no relationship, as you have rightly pointed out. Suicide is totally different thing.
Totally different.
Active euthanasia, you can say active euthanasia is some way you can say that person himself is saying that please, please, I don't want to live further because of certain things, and I want to die. I want to die, but since I am helpless, so please, with the help of medical aids, either by withdrawing or by introducing. So then all these are very different and difficult issues. So maybe we can have some separate webinar on this particular topic when we will discuss these issues threadbare. I think the time is now 5:45. It's more than three and a half hours, rather 3 hours 45 minutes. And I think it's time to conclude. And I'll take this opportunity to thank you all the speakers and moderators for giving their valuable time. And of course, all the participants.
Professor Adarsh Kumar ji.
Yes, sir. मैं just अपना.
Wait a minute.
Yes, yes.
Pertinent question, and that goes to Dr. Asa Srivastav. आप आशा श्रीवास्तव को.
Okay, one more question is there.
ये question उन्हीं के लिए आया. A question is how psychologists deal with prisoner when they end up having depression. What type of interventions are provided to them? Dr. Asa ji, are you able to listen me? Dr. Asa Srivastav.
Yeah. I am listening.
Question is, which has been asked, how psychologists deal with prisoner when they end up having depression,
Okay.
and what type of interventions are provided to them?
In every jail, there is a psychologist. So if you will see in every jail, there are psychologists and they are doing the counseling session also. And if any prisoner has any suicidal, depression or suicidal thoughts or anything is there, so the psychologists, they are doing the counseling and they are giving the treatment also. For the psychiatrist treatment is also available, and psychological therapy and different type of psychotherapy is also available in every jail. So this is every prisoner, if he has any type of psychological problem, not only depression. So in every jail, there is a psychologist, or they have in their panel, they have psychologists. So they are doing the psychological treatment.
Okay, thank you so much. Now the time is of Dr. Navpreet Kaur. Maybe she's also having some questions, clarifications, observations. Dr. Navpreet Kaur, if you want to say something, then you can. And thereafter, Dr. Professor Adarsh Kumar will propose vote of thanks.
I just would like to conclude that all the speakers, they have really given us very positive aspects that how to maintain our mental health. I just came across something that people used to ask that how to manage stress. There is nothing like to management of the stress. We need to manage good things, that is mental health, like we manage our classes, our schools, or our business, or our family. So as we know, this is in this scenario, this is a new scenario. Whenever we enter in a new thing, it is really difficult to start. But moving further, after the specific time, the things becomes easier. When we were student, we know that we found it was stressful for us to study, and when we came out of study, we found it stressful that we are not in our college, we are not meeting our friends. Then when we were unemployed, we were under stress. When we got job, there was more stress. When we were like, we are not getting married, we were under stress. And when we get married, everybody knows. I don't need to comment. So stress is just a part of life. Depression, loneliness, it is just part of life. We don't need to give or we don't need to manage it. What we need to manage is our mental health. We need to focus on positivity, as all the speakers focus that we should make a proper criteria of and our how our day starts and how our day ends. So it was a very good discussion, very meaningful Webiloque on stress and depression, loneliness, anxiety. So I thank you so much for, thank you Dr. Adarsh, Dr. Uday Pratap, giving me chance to be part of this Webiloque. Now over to Dr. Adarsh.
So now we have come to the end of this very interesting first of its kind international Webilogue. It's my pleasurable duty to propose vote of thanks on behalf of all the organizers, Alpha Forensic Lab, the Indian Association of Medical Legal Experts, the Malaysian Criminological and Correctional Association, the Asian Institute of Human Sciences and Development, Afero Forensic Science. These were the partners for conducting this webinar. Special thanks to all the speakers from India as well as abroad for sparing their valuable time, especially on the Sunday, and that too for 4 hours. That's a very exhaustive, but I think I believe that everyone has really enjoyed this very pertinent topic or very pertinent aspect of our life, especially become important during this COVID pandemic, when every day we are getting exposed to these kind of things. So once again, thank you all. Thanks Professor Uday Pratap Singh ji and Dr. Navpreet Kaur for moderating very well all these sessions. And special thanks to Ms. Tia alias Satyabhama for narrating her story. You really made us very emotional, and unfortunately we could not listen to you, but I promise I will, maybe in due course of time, we will arrange one full session for you, means your related aspect, because we have got the other from India also to complement your story. Maybe we will have one where you can share your journey of that and supplemented with the Indian counterpart very soon. And of course, this is the beginning of the webinar. We are conducting this webinar for the benefit of all of us, just to spread the knowledge. And this is a kind of charitable work which we have initiated. And the idea especially got during this pandemic. If pandemic would have been happened, naturally the webinar was out of question, because we were just arranging meeting over the conferences. But in a way, this pandemic has given us the opportunity to meet the friends and colleagues from all over the world, not physically, but maybe socially. So as our lawyer Sahab, Vakil Sahab has pointed out, physical distancing and social distancing. Yes, we are maintaining physical distancing, but of course, socially we are all meeting very frequently through these means of webinars and all these meetings. So once again, thank you all. Thanks to all the participants also who are very lively, interacting, and so many questions. This webinar, this is available on the YouTube, and all those, it will be shared on those channels also. Even if some questions remains unanswered, we have tried to cover all the questions. But even if it is some unanswered questions are there, you are most welcome to just send an email to any of us. We will try to respond that also.
Sorry to interrupt, sir, Adarsh sir. I think we should also give a vote of thanks to our media partners too, actually.
Yes, all the media partners, yeah, Times and all those media partners. We are all, without them, their support and all, we cannot do, because it's a teamwork basically. So thanks to everyone who was associated with this particular event, and we will be in due course of time, we will be having more of these kind of interactions on different topics, just to enlighten us, just to share our experiences of different countries, so that our society as a whole can be benefited. Thanks a lot, all of you.
Good night.
Bye.
Namaste. Bye.
Namaste.
Namaste. Goodbye. Take care. See you soon.
How was my Hindi? Was it good?
Namaste. Namaste.
Yes.
Namaste.
Yes, it's a good beginning. It's a very good beginning.
No, I learn Hindi every Mondays to Friday for about 45 minutes, so that when I do my tribal work with my volunteer work, I'll be able to communicate. So it's an effort. So.
Yes, so we will remain in touch, and definitely
Yes, please,
we'll
yes.
organize something exclusively on that domain, which will just entirely cover that aspect. Yeah, thank you.
Yeah, thank you everyone. Thank you. See you soon. Goodbye. Bye.
Thank you, Somnita, Nirosha, all the team members, Shobit, everyone
Thank you.
for having
Thank you.
this.
Thank you.
Yeah.